Good morning, and welcome to the Reunion 2024. It is such an honor to be here with all of you to celebrate Columbia Nursing and kick off this unbelievable day that we have planned for each and every one of you. I'd like to begin where I always begin when I have a crowd of folks in a room to talk about the discipline of nursing, which has brought me tremendous joy over the last 38 years. Rogers once said, "Nursing's story is a magnificent epic of service to mankind. It is about people, how they are born and live and die, in health and in sickness, in joy and in sorrow. Its mission is the translation of knowledge into human service. Nursing is compassionate concern for human beings. It is the heart that understands and the hand that soothes. It is the intellect that synthesizes many learnings into meaningful administrations. For students of nursing, the future is a rich repository of far-flung opportunities around this planet and toward the further reaches of man's explorations of new worlds and new ideas. Theirs is the promise of a deep satisfaction in a field long dedicated to serving the healthcare needs of people." What an appropriate way to begin our morning as we think about everything that's happening in the global community today. Nurses are peacemakers, nurses are healers, and now the world needs nurses more than ever to help heal a very broken society. My name is Kevin Brown. I am a registered nurse from the class of 1992 and the president of the Columbia University School of Nursing's Alumni Association. I am also the chief nurse, thank you, of Lenox Hill Hospital, Manhattan Eye and Ear Hospital, and a micro-hospital in Greenwich Village known as Lenox Health Greenwich Village. It is my pleasure to be here this morning with Jan Cobb-Siamba, our Capsona board member and class of 1974, celebrating her 50th reunion. I would like to thank Dean Frazier so much for inviting us into this space, into our home, to be with one another. And I want to thank deliberately the Reunion Planning Committee, specifically Laura Artizone, Daniel Billings, Catherine Brewer, Olga Brown Vanderpool, Hilda Haynes Lewis, Sandra Johansson, and Julie Yoshimachi. If you're here, can you please stand to be recognized? And as anyone who just stood and as I just stand before you knows, this would never have happened without Janice or Sharon. So Janice and Sharon, where are you? Just a big shout out. A very warm welcome to all graduates from the 4 and 9 years who are celebrating milestones in 2024. Big round of applause for the 50th reunion and 60th reunion classes that are here. And a special acknowledgement to the many alums who graduated recently. You are the next generation of nursing, and we are delighted that you could be here with us. And thanks so much to the many students who are joining us as well, some as program participants. Today is going to be a wonderful day as we hear from school's leadership, our incredible alumni and promising students. But there will also be time for you to relax and chat and explore and just get reacquainted with one another. After our speaking portions are over, we will break for lunch in the lobby. During that time, you can enjoy the student poster sessions in room 115 and check out our history room in room 427. At 2 o'clock this afternoon, you're invited to meet on the 3rd floor if you're interested in participating in a simulation activity related to the mental health and wellness of our nurses, such an important topic in today's nursing discipline. At 2:30, we're going to resume back on the 7th floor here to join 2 of our alumni who will be giving a talk called "It Starts at the Root, a Recipe for Health," which will be followed by a cooking demonstration and wine and food tasting. Don't forget to visit the 2nd floor and purchase some Columbia Nursing swag while you're here. Always proud to wear that Columbia swag, and I hope you'll be partaking in that as well. It's also important for us as an association to continue to develop and actually help folks come into the space, providing them with volunteer opportunities or hosting and attending events. The more present we are to one another, particularly for the new generation of nurses who need us. They need our wisdom to help them navigate a broken healthcare system and a system that often can be very trying to new nurses as they come into their careers. In the fall, we will be hosting regional events throughout the year, and we hope to see you there. I'm really happy to tell you that the Alumni Board itself has collectively raised $10,000 for the annual fund, achieving a challenge goal set for us at the end of the 2023 fiscal year. I'm thrilled to present this oversized check to the school, specifically to you, Lorraine, representing our generosity and commitment. Thank you also to our Alumni Board members for your support that is touching the lives of our students and helping them become the next generation of nurse leaders. I also want to welcome Julie Shamachi, who's here today, who will be taking the reins from me as the new president of the Alumni Association. Julie, why don't you give a stand and everybody could greet you? There you are. Being the president of this Alumni Association has brought me tremendous joy, and I thank Laura Artizone for inviting me into this space. I was someone who was very disconnected from the school after I graduated. It was Laura, in working with me at Memorial Sloan Kettering, that said to me, why don't you get involved? Never aspiring to be in this place, but knowing today what a joy and a reward it has been. As I think about the joy in nursing, something that I believe the discipline may be losing, we need to reground ourselves in what brings us meaning. What brings us meaning in the work that we do when we insert ourselves into the lives of another human being, someone who is not known to us. We meet people who are broken in spirit, in body, and mind, broken. And it is our role to bring them back to a state of wellness, a state of health, and partner with them on that journey to help them become who they want to be. It is sacred space that nurses go into each and every day. It's a deliberate decision to walk through a threshold of a door, to meet someone they do not know, and help them get well. In January of this year, NPR ran its My Unsung Hero series. And in this series, what struck me most was a nurse's impact on a couple's life. The gentleman, the father, the husband, Roger Lynn, his wife, Veronica, was admitted to a hospital with advanced disease. In her cancer diagnosis, they knew that her disease, she was going to succumb from her disease. And one day, they were acknowledging the fact that they were in a dark and gloomy room in the corner of a nursing unit. From out of nowhere, a nurse came forward and said, I found a room that was filled with light, that has views of the mountains and the views of the sky. And in that moment, it transformed what this couple was going through. It was no longer about chemotherapy, radiation therapy, surgical resection, but it was the humanism and the compassion in which nurses excel at that really rose to the occasion in that moment. When his wife did die from her disease, he remembers saying to this nurse how grateful he was that she thought of this basic human need, to be able to be exposed to the outside world. Her kindness in that moment was a beacon of light amidst darkness and a very painful time for them that she helped them get through. Before I depart from the podium this morning, I want to start our day out with something fun. I want to invite two alumni forward, Krista Heinzler and Stephanie Wright, because our dean has some books that she selected because they are very, very meaningful to her. And she wants to share these books with you so that you can actually take from them something for yourself as she has taken meaning from them for herself. So we invite Krista and Stephanie forward so we can give you these books. Come on up. books.
I do.
It is now my privilege to introduce Jan Kabziamba from the class of 1974, Kupsana board member, who will also offer some welcoming remarks. I wish you all a great day, a good weekend, and a happy Nurses Week. Take good care.
Thank you, Kevin. Very, very nice. Thank you. Good morning, everyone. I'm Jan Kabziamba, class of 74. I'm thrilled to be here for my 50th reunion, but I'm even more in awe of the people here, the ladies, for their 60th. So I can only hope to be here 10 years from now. So I bring greetings from Columbia University, Presbyterian Hospital, School of Nursing, Alumni Association, the school's original alumni association, founded in 1892 by Anna C. Maxwell Hall, everyone, and her first class of nursing graduates. I've been on the esteemed board of this nursing alumni association for over 30 years. The board of directors continues to support alumni in need. We give them stipends every month, those who need them. Sometimes if they have a health emergency, we will give them money. And of course, our scholarships. So we especially believe in offering funds for scholarships because that, for everyone, is very important. I'm pleased to announce that we are again presenting the school with $60,000 for the benefit of the scholarship fund. Our president, Joan McCormick, class of 1961, regrets she's unable to be here today. It's gratifying that we are all able to meet here in person in this beautiful building, and I want to now introduce Dean Frazier.
Thank you so much. Wow. It's wonderful, wonderful to be here. The energy in this room is just amazing. I'm delighted to welcome you all to this beautiful building. You know, the one great thing about this building is it is paid for. Really? And what that means to us is every penny we raise is going to student scholarships. We owe so much to the history and the people that have led this school and given and donated and put together this beautiful package that we have. It helps us recruit the best, and it helps us stay healthy. Look at the light, look at the bridge out there. I mean, it really is we're so fortunate to have it. So anyway, this is your home, so welcome home, everybody. I'm delighted to have you here today. And the building is built on land that used to belong to the Lenape people. And we always honor them and think about them. And if you really want to understand that journey, read New York, the novel. Has anybody read that? Yes? You will get an idea of what beautiful, beautiful land this is and how we actually took it from the Lenape people. And so we honor them and the people who seceded their land wherever that is today. So it's nice to recognize them. So there are many reasons I'm thrilled to be here today. I will tell you, my day didn't start out that well, of course. I'm wearing my stripes, got all together, got dressed, got early, felt so organized, got in my kitchen, and I have this, I sound like a healthcare provider, a solution that I put on pears to poach them. It's wonderful, gingery, lovely. It's one of the ways I take care of myself. And I shook it, and it went all over the kitchen. And I thought, really, of all days? Then I get here, and I get this text from my husband, I need to talk to you. Not urgent. It's a flat tire this morning, on the way through a storm to see his dad. And I said, I told you not to go through the rain this morning. But you know what? It's like one of those days, right? but here we are. And many of you all went through the same things. I've heard you're here in spite of life, in spite of things that you've traveled far, and I've heard different stories. Thank you for making the effort to be here. We appreciate it. Many of you have come from many distance. We have someone here from Korea. Where is our guest? From Korea? Yes? Yes? Yes. She's here to be with her daughter, and if you look at her traditional dress and the backpack that she has that's handmade, we have such a wonderful representation of really the world here. So thank you. And I took up a lot of time to do the welcome, but here we go. So, and I also want to thank you for coming at this unusually difficult moment. We were really concerned. Will anybody come? And you came, and you come because you love this school. And it's a difficult moment for this great university that we're all a part of. And I'm sure most of you all, well, I know, who doesn't know about the protests in Morningside? The whole world knows about it, right? And it's making headlines across the country, and everybody has personal opinions on the Middle East crisis that prompted the demonstrations. And we recognize the deep distress and pain from all the varying views. And people have a right to have their opinion and express it, and we understand that. So I have two highlights to talk about on that. First of all, we at Columbia, in all parts of this university, through the larger campus, denounce hateful language, calls for violence, and the targeting of individuals or groups based on their beliefs, their ancestry, their religion, their gender identity, or any other identity or affiliation. There is no room in our community for that behavior. The university is committed to ensuring safety and security for all of us. The second point is, we at Columbia Nursing, as well as our colleagues at CUIMC, believe that our strength lies in the shared vision of advancing health and well-being. That's what we're about, right? That means we're devoted to engaging and discussing the issues roiling our campus, even those conversations that are hard, or perhaps especially those conversations that are hard. Dialogue is most productive when it is informed by empathy and respect. And of course, those are foundational concepts in nursing. So the dialogue needs to happen under those parameters. So as the university navigates this challenging time, there are no easy answers. There are not. But we are committed to contributing to the effort to seek solutions while we're staying true to our mission of advancing health and well-being, because that's what nurses do, and that's what we've always done. So, and speaking of what nurses do, foremost among the reasons I'm thrilled to be here today is we have a chance to celebrate. And listen, I can see by the way people are dressed and the colors and the vibes that we are here to celebrate nurses' central importance to our nation's health. Central. We are here to salute nurses' commitment to constantly working and to improve the health of our society. So, I'm going to be interviewed at ABC, and we talked about the questions, and they said, what would you like to say to nurses of the nation? And I think we have to say thank you. Thank you. Thank you for the body of knowledge based on evidence that has produced this amazing profession that enables us to have the type of nurses, Kevin, that you talked about, that see beyond the circumstances and that are privileged to be a part of the journey of people's lives and to be able to see that sunlight sometimes makes the biggest difference. We think about well-being, and that's what we're going to talk about this whole weekend. This whole today is well-being. So happily, this society recognizes the commitment of nursing. For the 23rd year in a row, nurses have been recognized by the Gallup poll as the most honored profession, right? Trusted for honesty and ethics. So we should be at the table, right? They should be talking to us. Maybe we could find a solution going forward. And that enduring respect for nurses is something that each and every one of us can take pride and take credit for. So congratulations to all of us here today. It's also significant that we're gathering for our reunion shortly before the whole world pays homage to our profession, right? In May, the National Nurses Week. But we don't need a special week to know that what we do is special. We see it in the eyes of our patients, in the eyes of our students every single day. And we're just about to recognize that we'll graduate 350 exceptional students on May 14th in Army. We're so looking forward to that, bringing to the world the nurses that they need and the leaders of tomorrow. As you know, about 2 years ago, we welcomed Katrina Armstrong as the new dean for VNS and the CEO of the Medical Center. And almost a year ago, we welcomed Manoush Shafiq. She's the 20th president, and both Katrina and Manoush are strong advocates for nursing. In fact, Manoush was in this room right here when we were talking, and she said she has, I think, twin children, and wanted one of her kids to be a nurse practitioner. So she not only knows nursing, she knows it well. So we're thrilled and fortunate to have them at Columbia. Manoush has been here with me. She spent an hour and a half with us at one time. She's really been in this building and knows us. And the deans, worked with her many, many times throughout this crisis. So she shared her strategic vision with us when she came to the school, and her emphasis is on 3 things: mental health, right? Is that about nursing, right? Community, and well-being. And one other, AI. So when you think about that, every one of those impacts nursing, and we will be leaders in all of them. We want to reinforce how inherently aligned nursing is with her foundational, she calls those her 3 pillars, around the power of connectedness. She wrote a book, What We Owe Each Other, and I was able to visit the London School of Economics that she led and met some of the people there that talk about well-being. Actually, it was an invited panel, a global panel about well-being around the world. And Sir Richard Laird, who represented her school, I can see why she really is involved in mental health and really directing us. So we're thrilled to have her here. So we as researchers, educators, and practitioners and leaders develop and strengthen the community that we are in through service, practice, and research. That's what we do. And it took, so there's a lot to look forward to in these coming years. We want to be leaders. She wants all the schools to be leaders, the top 5 in those initiatives. So at this time, I'd like to extend, we've talked about the class that are here, an extra special welcome to the class of 1974. Are you here? Celebrating your 50th reunion? Congratulations. Wow. Thank you. I'm so glad you all could be here. These are great pictures, aren't they? I love the one with the nurse and IV. I love that. Love all of them. And so I hope you'll stay for the Alumni Awards ceremony at the end of this talk. We'll be presenting the Distinguished Alumni Awards to Lucinda Cantry of 1991, Jennifer Dorn. Jennifer, are you here? I haven't seen her. She's traveling probably. 2005, Jared Kutzine. 2005, Carolyn Sun. 2015, Samantha Stonebreaker. 2016, and an early career alumni, to Alum Tark. Are they here? Any of them here? We're going to be recognizing them, of course, this morning. In addition, I have the honor right now of presenting the Anna Carolyn Maxwell Award, which is conferred to the alumni or alumnus or alumni whose achievements. Where is Midge? Oh, there you are. Exemplify the ideals and traditions of the school and its founder, from the class president to the founding member and first president of the school's Alumni Association to chair of the board of advisors for over 2 decades. She has served the school loyally and thoughtfully, and she received the Columbia Alumni Medal in 2007, and she works behind the scenes on fundraising campaigns on each one of her milestone reunions, including her 55th, which she is celebrating today. We would not be who we are today without you, Midge. Congratulations. And Midge up here, because you're that ovation. Michael's, who's coming? Sorry, I need to take time for this because she's got to have this front and center in her home because you have had the support, and I think that's what I really feel and what we want to experience today. So here we go.
And you're so tall and I'm so short.
I know. Can you get tall? Do you want to say something? No. Okay. Okay. So no Columbia alum needs to be told that our school is a special place with a rich history of innovation in nursing, and this marks the 132nd anniversary of this school. 132 years, wow. This year, we are also celebrating the anniversary of something that would have been impossible 132 years ago, even 32 years ago, the 20th anniversary of the DMP program. First of its kind in the country, and a model for 400 other programs across this nation, and they are across the globe. Started right here. You know, what we value is innovation and influence. It was innovative and it influenced nursing across the globe. We now graduate over 100 DMPs each spring, and we are recognized as one of the leading programs in the country. Our DMP alumni include many of you here today, have gone on to serve in the most demanding positions the field has to offer, as senior nurse practitioners in complex medical settings, graduate-level nursing educators at major academic institutions, and leaders of healthcare organizations ranging from maternity centers in urban areas to federal substance use programs. And we have Mary Mundinger, who took the helm in 1986 to thank for our DMP program's inception, as well as the establishment of the nation's first independent primary care practice run by nurse practitioners that we know today as the Nurse Practitioner Group. And of course, thank you to all of our faculty and staff who have helped the program and practice in the years since their founding. So wow, what a legacy this school has. Mary's not here today, is she? No, she was here last night, so thanks to Mary for many things, and I also always thank her for this building. There's Judy Honig, one of our first people in the class, the DMP class, who also helped with that. Oh, which brings me to another individual. Judy, you know when to enter. An alum whose leadership has had an enormous impact on the trajectory of the DMP program and in the school. And first, she was in that first class, as was, many of you know, though, that she is retiring. Very soon as the Dean, Vice Dean of Academics and Dean of Students. Actually, when she told me, it was hard for me to listen. I had tears in my eyes and I was choked up and I thought, Lorraine, you've got to let people go and love them in their life, but it's really hard. In her leadership role, she helped design the DMP program and so much more. For these and for her other innumerable contributions to the school, we owe Judy Honig a debt of gratitude. And on a personal note, her wisdom and leadership have been invaluable to me. And thankfully, she's staying on as the dean's consultant. And you will hear, this isn't the last time you will hear from her. And so from now, please join me. Judy, stand up, please. We want to thank you for those incredible years. We love Judy Honig, and she loves nursing and she loves this school. She loves this school, and we're grateful for you.
Thank you, thank you. It's been a privilege to be part of it, and I'm glad to be able to continue.
We're not letting her go.
Not so fast.
We're a funny couple, right?
Thank you. So I want you to join me in giving an equally warm welcome to Mary Hickey. Mary, where are you? Is Mary here?
Mary just had to switch with a meeting with Judy, so Judy could be here. So
Oh, okay, well, there you go. She's our new Vice Dean of Education. Actually, when we recruited her, it took us over a year. The search firm had just given up with us. They said, you guys are so picky. And they were. I mean, every candidate we looked, we talked to, and we said, not a good fit. We really needed to know that the person who was here would be a good person to follow in Judy's footsteps and support the culture of the school, and we've done well with Mary. She served in leadership roles at public and private universities, advanced strategic plans and missions. She joins us from Adelphi University, she was the Associate Dean of the college, in the College of Nursing and Public Health. And please get a chance to know her and make her welcome. So now it's my privilege to give you a brief recap of the school's recent achievements. And Reunion is about that. It's about us celebrating our achievements, our culture, and our commitment to patients and the support and admiration of each other. That's why we're here today. So I'm really awed by us individually and collectively together, the effect that we've had, this institution. And we've been through a lot. We've been through a lot. And we've grown, and we've changed, and we've improved in our operations. And I'm especially proud how we've impacted the structural aspects of our society and address the inequities and disparities in healthcare and education. And as a result, even nursing, even in its early days, we're good at adapting and adjusting and changing. And at the same time, though, we've held firm to the ideals and principles and redoubled our commitment to create a culture of inclusion and belonging so that everyone within Columbia nursing community, as well as everyone that we deal with outside the world, is valued, and we do that well. So before I share with you some updates on our social justice and health equity work, I think it's important to mention here that for us as a profession, I don't think much has changed in how we treat patients. As a school, We are more diverse in terms of faculty and our student body, but our perspective, our focus, and our commitment has always been and will always be on serving populations and communities regardless of the race, gender, religious beliefs, or sexual orientation or ethnicity. We continue on that, committed and recommitted. So in helping us with this important work is Ashley Graham Perel. Is Ashley here? Stand up, Ashley. Yeah. She's the new Director of Diversity and Cultural Affairs, and since the retirement several years ago of Vivian Taylor, you all remember Vivian. Ashley joined us in 2021. She's an assistant professor of nursing. Prior to that, she taught at NYU, and her clinical background is medical surgical nursing, and her research centers on diversity and inclusivity in nursing with a focus on admissions, retention, and success of diverse nursing students. She also received Columbia Provost Interdisciplinary Teaching Award for a course that she developed on nursing history and anti-racism affirmation. If you get a chance, please introduce yourself to Ashley. She's top. She's very good at what she does, and we're very proud to have her on our faculty. Our work in the diversity arena has been extensive. Various committees and task force have worked on improving the transparency of our tenure and promotion processes, on giving faculty clearer guidance on those processes. We're also committed to intentionally recruit and retain and develop practices to ensure a diverse workforce. Our Racial Equity and Education Committee developed an anti-racism toolkit that supports faculty in regularly reviewing and revising courses and developing new ones. We also sponsor numerous events and workshops, from film presentations to book discussions, aimed at the never-ending ensuring that our eyes and minds remain open to the toll of racism and the enduring value of justice and equity. We also do research on diversity and inclusion, and we have launched several research centers to support that. So we're making a lot of progress, thoughtful progress, that will always continue as we grow and get better. Research. Our focus on research has an emphasis that dates back many decades at Columbia Nursing. It's resulted in a recent honor that we can take pride in, being #1 in NIH funding among the colleges of nursing at the National Institutes of Nurse. We received this past year 38 grants that brought in a total of $23.9 million in funding. Amazing. So our research program has grown immensely over the past few years. In 2016, we were 11th. Then we rose over the next few years to 5th, then 6th. We were at 4th for 3 years. But we don't take for granted that we're #1. And we owe our gratitude to the Vice Dean of Research for Strategic and Innovative Research. Betsy, where are you, Betsy? Stand up. Yep. Take a bow. And to the administrative staff and grants management office, and of course to the faculty and the postdocs who carry out all that amazing research. We're overwhelmed, and I think we stand really in a good position for the next year. So fingers crossed we watch that. So here's some incredible work happening at the school. Our science investigate the underpinnings of patient symptoms, disease risk, illness progression, and health disparities. And they seek to improve the lives and work environment of nurses. Don't underestimate what nursing research does. You know, when you go through an illness, you are, for a second, you're in surgery. That's very important, or you have interventions. But that journey, that health journey is long, and it needs a lot of support from nursing, and that's what we do well, and that's what our research gives us, that body of knowledge to be able to do that in an amazing way, and it's remarkable. So our researchers are promoting health equity through the interventions at individual, interpersonal, and systems level. And we're also on the cutting edge of utilizing machine learning and AI in nursing research. And we have amazing researchers in AI. Global is another area in which we have long been a leader in our global health. And that leads me to share another anniversary for our school this year. 2024 marks the 10th anniversary of our global student clinical program. Jennifer's not here today, but we have students that go around the world since 2004 to 20 different sites. And what they learn around in these different sites, they're not there to watch, they're there to do clinical interventions, right? And they come home changed people. They do. I mean, they practice in places where there's great inequities, and they have to come up with innovative nursing care. They learn. They learn that, you know, happiness and fulfillment doesn't always come from what you have. They work with people who are content in many different ways in life, and I think that's a great lesson for them and all of us to learn. So, and it's not just our program that's global, our faculty is global too. We have experts on our faculty from Armenia, China, Romania, Russia, and the Middle East. And they use these skills to help them build research capacity, curriculum, and faculty development through collaboration with international universities, particularly those in low resource settings. So, and we also have faculty from 3 alumni from who are Fulbright scholars and 2 current Fulbright scholars with us on our faculty. So we're pretty amazing, pretty global. Jennifer Dorn, our Assistant Dean for Global Initiatives, and Yuhei Ferng, the Director of Global Health. Is Yuhei here? No, they're all busy doing their work. Are amazing when it comes to global support for our faculty that travel. I mean, they make it so easy for our students. We have relationships in these countries around the globe, personal relationships when they accept our students. That is pretty amazing. Our educational programs are thriving as well. Both of our degree programs and our non-degree programs are thriving. And so is our open program. You know, we have an open program that prepares people in prerequisite courses that they need to get into nursing. You don't have to be a Columbia student to make use of those. You can take them and go somewhere else. But we know that those programs have rigor, and we know that when our students take them, that they have a good basic knowledge in those prerequisites. And it also gives the students a chance to try Columbia. It's pretty daunting and overwhelming to be at Columbia for some students, for all students really. And it gives them a sense of, okay, I did the open program, I did okay, maybe I can come to nursing. And I think that's a great use of that program. We also continue to attract stellar students. You heard the student last night speak. Oh my gosh, our students, stop and talk to them. They are articulate, they are talented, they are leaders waiting to be honed and put out to the world, and they're going to make a difference. And we have about 750 students enrolled in our degree programs, half of them in the master's and half of them in our doctoral programs, and 300 who are on various certificate programs that we have at the school. Our MDE graduates either go to the doctoral programs or find a job, and trust me, everybody wants to hire them. Their NCLEX pass rates are 96%. Now, if you look at the NCLEX pass rates around the globe, average in states, average in New York, way lower than that. I mean, I want to say 70s, some of them, and you think, We're at 96%. So, our online advanced clinical leadership program and management is giving educational programs to people within our national reach that join us. 90% of our DNP students find employment after graduation. 90 is like 100. When they want to get employment, they do it. 2024, Kevin, you may know this, it's number one job is for MPs. And not just for, we need a diverse workforce. We need men in nursing. It is a wonderful profession for any talented person who wants job security and self-selects as a passionate and caring individual to come into our profession. Our curricular innovations include our impressive roster of global integration sites, clinical placement opportunities for MDE and DNP students across the U.S., across New York City and upstate, and we have a collaboration with numerous clinical partners, and that makes a big difference in the quality of our program. The commitment I mentioned earlier to social justice and health equity resonates strongly in our academic arena. It's reflected across all of our programs, and it has an expansive definition of non-discrimination, and our faculty embrace it with rigor. We're not standing still. Initiatives on the horizon include certificate programs in clinical leadership and nursing education. We really need to do more in nursing education. Innovation in mental health arena, and the interprofessional education and practice, and constant efforts to use technology. In fact, I talked about AI. Manusha's one of her pillars is AI, and we need to look at how we teach AI and how we use AI to teach, right? And I stop and talk to students and I say, tell me how you're going to practice when you graduate. Tell me how you're going to look at data. And we need to do better in that. And so Stephen Ferreira, Stephen, can you stand up? He's going to be leading us in AI, a big effort and lots to learn. But we really have to transform how we practice. And we also want, and this is important for everybody, we want alums to be able to come back and brush up on those skills because it's changing the world, right? And Manush wants us to be number one in AI in the country. So we have that really across the whole university. We have branches working together to make that a reality. So our students, we're doing the work necessary to make the pursuit of nursing profession accessible to more diverse applicants. You heard last night, we had a student who never thought she could be in Columbia, and she's here and she's amazing. She's going to be a fabulous nurse, as many of our students will. So we have efforts like establishing our men in nursing students group to make sure that our male nurses feel here and welcome. We have a holistic admissions process. We have a pathway in leadership and advancement nursing program known as PLAN. Judy Wolf, are you here? Yep. She's leading PLAN, and it's an amazing program. It's for students who are from economically disadvantaged backgrounds. We support them with scholarship, with mentoring, and tutoring. And over the past 3 years since it started, the program has supported over 80 students. Each one of them passed NCLEX, and 100% are working as registered nurses, are enrolled in our doctoral program. So it's not enough to admit diverse students. You have to commit to them, commit to getting them through, and we make sure that we do that. And Judy leads an amazing program that really is influential. She presents it around Columbia and really nationwide. So I want to emphasize that all the students we recruit are committed to strengthening humanizing healthcare, thanks to the guidance of Judy Wolf. This year, we are especially pleased that 40% of our incoming students, 40% of them are first-generation students coming to Columbia University. Pretty amazing. 10% of those students are international. So I'd like to tell you about 3 students to give you an idea, and you don't really need an idea of how exceptional our students are. And you all were exceptional students, right? This is to let you show we're continuing in that legacy. Mark Jean is not only a graduating student in the MDE program, but also a 2nd lieutenant in the Army National Guard, where he's an assistant intelligence officer. He's maintained a 3.85 grade point. He's published articles on emergency preparedness and participated in military response efforts following hurricanes and other crises. And he's currently in India completing his clinical integration. Kelly Rojas is now in our DMP program, having completed her MDE last year. She did a clinical integration in the Dominican Republic, participated in a media campaign to highlight the role of nurse practitioners during Nursing Week. She co-founded the Latinx Student Organization. She serves as a peer mentor and volunteers as at the student-run clinic for uninsured patients. And finally, I'd like to highlight Brittany Taylor, now in the final year of our PhD program. She's researching genomics and health equity and intends to focus her career on leveraging data science techniques to bring a more equitable mental health care to Black women, work for which she has already received an NIH predoctoral training grant. And in addition, she's a trained cellist, an outdoor adventurer, and a devoted foodie. Really? We have pretty amazing students. Yeah. Are any of you all here? Nope? Okay. They're working in India and doing what they're supposed to be doing. You know, won't our patients be lucky to have those type of students with them? Absolutely, absolutely. In practice, the Nurse Practitioner Group has expanded its clinical offerings this year to create same-day appointments for Columbia employees. It's also partnered with the Weight Loss Clinic and nutritional services. So we offer a weight loss program that uses the latest medications along with behavioral and lifestyle modifications. And that's a key advance in the clinical landscape. We serve as lead clinical service in the Columbia Doctors Community Outreach Program, spearheading numerous public health screenings throughout the city, including cancer screenings, tobacco cessation programs, blood pressure screenings, and immunization clinics. 23 events impacting 325 patients were completed last year. All these events serve our community and give our students valuable hands-on experience. And remember, community is one of the 3 pillars that our new president emphasizes here at the university. And thanks to our Helene Fuld Simulation Center, we provide state-of-the-art instruction and important programming that brings together academic and industrial expertise in the field of artificial intelligence, there's that word, AI, to help us advance this technology in clinical and academic programs. We need to lead, that's another pillar, AI. Another noteworthy development in the clinical arena was the creation a few months ago of the Division of Nursing Practice. So we collaborate now with the Columbia Nursing in the Medical Center and Columbia Doctors, and this new entity managed by and really created by the School of Nursing defined a career ladder for 800 nurses and advanced practice nurses at Columbia Medical Center who were really not connected to anybody. We'll ensure that they're updated and they'll be part of the school, which is pretty amazing. All of this clinical work was overseen by Stephen Ferreira. He's back, he's our AI guy. And Mara Abbott. Is Mara here? And I want to make a special note of the fact that Stephen has begun his official 2-year term as president of the American Association of Nurse Practitioners. Congratulations, Stephen. How many people are in your organization? 120,000. Influenced right here by Columbia School of Nursing. So now we have awardees to emphasize. The faculty who make this amazing work possible are regularly recognized nationally by our peers, and here's a few highlights. Over the past year, 10 faculty and alumni were tapped as American Fellows of the American Academy of Nursing. Any of you all here? Yep, here we go. Yep, Casey? Yep, stand up. Congratulations. One of our faculty members was inducted into Sigma Theta Tau Honor Society of Nurses International Research Hall of Fame, bringing our total number of faculty to be honored in that way to 11. I'm thrilled to share that the fact that Mary Mundinger was recognized as a living legend by the American Academy of Nursing, their highest honor given to visionary leaders who have made outstanding contributions to improving health and advancing the nurse profession. And I think we have another living legend with us. Elaine Larson, do you want to stand up? Yeah. These are truly amazing honors, and I have chills just talking about it. We are so fortunate to have these individuals at our school. In addition to our faculty, these achievements are also a testament to our faculty and students, our staff and students, and our alumni, you all. I might add, it truly does take a village. It takes all of us to really be innovative and influential to this country and the globe. And in particular, I'd like to express my deep gratitude to our leadership team. Without their expertise and dedication, we would not be where we are today. Some of them I've mentioned in the course of my remarks, but I'd like to highlight them at this point. I see some of them. Jason, you all stand up, please. Betsy, who else? Judy Wolf, who else is here? Janice. Oh, of course, Judy Honig, Ashley. Oh, Mary, you arrived. Hi, Mary. That's Mary Hickey. Congratulations. You know, one of the best things that happened to me coming to Columbia is that this is the most amazing organization I've ever had the pleasure to work at. Everything that we do is classic and professional. Even through all these issues, I'm telling you, it's always, I went to the Student Senate and thought, oh, it's going to be crazy. Not crazy, professional. One of the gifts that I received when I came here was that I had inherited an amazing leadership team. And some of them I've recruited. They're amazing too, but thanks to all of them, because we would not be where we are today with each and every one of them. So, well done to you all. So, our campaign. I'd like to share with you an update on our scholarship campaign, of which I am very proud. To meet the evolving health needs, we just don't need nurses, we need more nursing leaders, and that's what we graduate here, delivering, innovating, and influencing care on the ground here in New York and across the world. Our mission as a school is to produce tomorrow's nursing leaders, and I'm proud to announce that Columbia Nursing has raised $21 million towards our $30 million campaign for scholarship and student support. And those are the leaders that we need. Students remain my top priority, and I'm telling you, it's because of this alumni in this school and this building that's paid for, we can make it our priority. I'm confident that we will achieve and surpass this goal, and I hope that you'll join me in supporting our future nurses. A key part of this campaign is our annual fund, and I'd like to take a moment to thank our Alumni Association Board for their $10,000 and give a special shout out to the class of 1969 for reaching their class goal of $20,000. Are you all here? Raise your hand. Yep, stand up. All of you all. I mean, really and truly, thank you, thank you, thank you. And of course, a special thank you to Capsona for their generous donation of $60,000. Thank you for everything that you do. And once again, I will tell you that this goes to support our students. And let me remind you that all the gifts count toward this campaign. So with your help with all of us together, we will continue to support our school's great legacy of devising new ways of educating nurses. Critical. We're in the changing of how we practice and how we educate. We're going to lead that way, exploring new areas of research, evolving new paradigms of patient care, and of course, identifying new and innovative ways to advance the profession of nursing regionally, nationally, and globally. Building on that evidence, building on what nurses around this country and globe use to practice. That's what we're doing. So I hope very much while you're here on campus that, well, you're having time to explore the building, right? And our wonderful 7th floor and the views that we have on our rooftop terrace. And we're also proud to have you today to show you our spring issue of our magazine. And it is, Kevin, I think we just did it especially for you, The Joy of Nursing. And you're interviewed in here. It's a wonderful, wonderful time. We talk about burnout. It's time to talk about the joy of nursing. So it's hot off the press, and Linda Muscat Rim, our Office of Strategic Communications, they work hard to get ready just for you all. And we know you read it, and thank you for doing that. And we know some of you are in here. So the article that it's based on, Ashley does the interview of nurses, leaders that talk about the joy of nursing. And boy, we just hear it in your stories. We hear it in the nurse that changed that room. That's the joy of nursing. And that's crucial that we find that sense of meaning in their work. But that makes it all more important that we find the joy in what we do here. And trust me, there's joy in this room. I know that. Everyone holds personal opinions about where we're going, but we are going in the right direction. So, my focus is on health and well-being. And the 4 things we're going to be focusing, developing a class for the students on health and well-being. How do you stay healthy? And, there's 4 things we're going to talk about. Number 1 is family. Stay close to your family. I mean, I know we all have different odd people in our families. I do, we all do. Stay close to them all. It's not for what they give us. Or, they're our meaning, friends, right? Stay close to them. Our faith, whatever that is, meaning in whatever that is, know that you're not just on your own, but you're part of something greater than yourself. And purpose. Have a purpose that can be your job. It can be what you do in your volunteer work, but have a purpose in your life and have meaningful work. Have meaning in your life. Those are all really, really important. I thank you that you've included the School of Nursing in your meaning and your purpose. It means a lot to us, and for the joy that you bring for us. And so we talked about books that I particularly am going to be using in this course, and I've tried to share those with you today. These are 2 of my particular favorites. Build the Life You Want, Arthur Brooks out of Harvard. I've met Arthur, and he has a lot of research on, and it's talks about happiness, but not happiness, but a real true happiness and joy. This is another great book, Self-Compassion. Oh my gosh, this is a wonderful book if you read it slowly, and it takes time, and I've learned so much through this. Christine Neff, and there'll be other books today, so we've had a raffle. Janice, you want to tell me who gets these?
Sure. So earlier today we gave 2 books already, and then these raffle winners, we have Gerald Cohen from the class of 1974 and Anita Nuremberg as well.
We are going to move on to our Alumni Award Ceremony. I would like to introduce Dr. Maureen Murphy-Rucco, who will be giving out our first award.
Thank you, Sharon. Good morning. It is so great to see everyone today celebrating Columbia Nursing. We'll now be recognizing the 2024 Alumni Awardees. Before I begin, I would like to recognize the Distinguished Alumni Award Committee for their work in the selection process. A special thank you to my co-chair, Dr. Ann Margaret Navarre, and committee members Dr. Susan Chase, Dr. Elizabeth Cooper, Dr. Rachel Lyons, Dr. Olivia Velez, and Dr. Stephanie Wright, who also co-chairs the Early Career Alumni Award Committee with me. The Distinguished Alumni Award Committee has selected 5 Distinguished Alumni Awardees and 1 Early Career Awardee. For more detailed information about the awardee, please visit the Alumni Awards webpage on the school website. Our first awardee has been selected for the Distinguished Alumni Award, Distinguished Career in Nursing. Dr. Jennifer Dawn, nurse, midwife, and educator, has been instrumental in transforming nursing educational systems and in establishing policies aimed at reducing health disparities among vulnerable populations. She earned a Master of Science in Nursing and a Doctorate of Nursing Practice from Columbia University in 1985 and 2008, respectively. Early in her career, in partnership with Dr. Ruth Lubbock, she initiated the first freestanding birthing clinic in the Southwest Bronx for women who had limited access to perinatal care. When the HIV epidemic entered the community in early 1990s, Dr. Doran advocated for and helped change the protocol for HIV-positive pregnant women, allowing them to receive care at the clinic. Dr. Dorn also served as project director of the Global Nurse Capacity Building Program for more than 10 years. To address the health demands of the HIV pandemic, strengthen primary health care systems, and improve global health outcomes, Dr. Dorn mentored a team of nurses and midwives in 10 sub-Saharan African countries to transform the educational, clinical, regulatory, and policy infrastructures of the nursing workforce. Furthermore, she partnered with multiple ministries of health to ensure that the program is sustainable within each nation's strategic plan. Dr. Doran also led national teams to design, implement, and transform nursing and midwifery education programs at several sub-Saharan African countries, including new program development. Additionally, she facilitated a regional African nursing network, allowing innovations to be disseminated at regional and global nursing forum. Dr. Doran also implemented and leads the Global Health Program at Columbia University School of Nursing, allowing students to learn from other nurse leaders in Global South countries. One of Dr. Doran's research studies aimed to document through oral histories the experiences of nurses and midwives on the front line of the Ebola outbreak of 2014 to 2016. As a result of this research, Dr. Doran helped develop a policy roundtable to present recommendations for a more effective pandemic response based on the nurses' experiences and perspectives. She also continued her research through COVID-19 pandemic. Dr. Doran, a fellow of the American Academy of Nurses, also served as a final consultant for the development of the World Health Organization Strategic Direction for Nursing and Midwifery. For her commitment to promoting diversity and advanced health equity, advocating for national policy changes addressing maternal mortality, developing graduate programs around the globe, and disseminating her research nationally and internationally, we honor Dr. Doran with the Distinguished Career in Nursing Award. Unfortunately, Dr. Doran was not able to be with us today, but I would like to read a few words from her. Greetings from Ghana. I am currently attending a summit meeting with midwives across the African continent entitled Unifying Midwifery in Africa and the African Mother, Child, and Adolescent. I am connecting with many colleagues and meeting new ones. I am very much with you in spirit at this reunion. I am honored and humbled to receive the 2024 Alumni Award for Distinguished Career in Nursing. I give gratitude for this prestigious recognition. Columbia has been a continual thread throughout my life work as a nurse and midwife. I recently published a book, Mothers, Midwives, Reimagining Birth in the South Bronx, Breathe, Now Push, to honor these women and their collective knowledge of what is necessary for a safe maternal healthcare system. Throughout my journey, Columbia has been my foundation. I carry this with me wherever I go. I thank you for helping me lead a life that is useful and allowing me to stand shoulder to shoulder with nurses around the world. Thank you so much, Jennifer. Now I'd like to call upon Dr. Ann Margaret Navarro to present the next two Distinguished Alumni Awards. Dr. Navarro.
Thank you, Maureen, and greetings to all. Our next awardee, Dr. Samantha Stonebreaker, was selected for the Distinguished Alumni Award for Nursing Research. Samantha Stonebreaker, nurse scientist and educator, has made significant contributions to eliminate health disparities through her innovative and impactful research. She earned a Doctor of Philosophy from Columbia Nursing in 2016. She also completed a postdoctoral fellowship in informatics at Columbia University School of Nursing in 2018. Dr. Stonebreaker's research involves user-centered design and rigorous evaluation of infographics to enhance communication between patients and their healthcare providers as a strategy for improving patient-centered outcomes. She has improved care for thousands of Latinos living with and are at risk for sexually transmitted infections in the United States and the Dominican Republic. She pioneered a trilingual English, Spanish, Creole intervention comprising culturally congruent, health-literate infographics that facilitate patient-provider communication, which is deployed via a mobile app. Since the preliminary evidence of the impact on HIV-related outcomes was so promising, the United States Agency for International Development adopted this intervention for its program. Dr. Stonebreaker's cultural awareness, language skills, and sustained engagement uniquely positioned her to influence the research infrastructure in clinical care at Clínica de Familia La Ramona, a site in the Dominican Republic, serving tens of thousands of patients. She built an essential research infrastructure that continues to thrive and generate better patient care. Dr. Stonebreaker has demonstrated expertise in a variety of quantitative and qualitative research methods. She is currently funded by the National Institute of Mental Health for formative work to develop differentiated communication tools to facilitate transgender women's recruitment and enrollment in HIV vaccine trials. Currently, Dr. Stonebreaker is an assistant professor at the University of Colorado. She has disseminated her research through numerous presentations at national and international conferences and has publications in a variety of clinical, health education, public health, and informatic journals. In recognition of her expertise in nursing research, utilizing research to improve clinical practice, and serving as a mentor to novice researchers and graduate students, we honor Dr. Stonebreaker with the Distinguished Alumni Award for Nursing Research.
I had so many mentors, I can't do this without my notes. So I wanted to spend my 2 minutes saying thank you to so many people from Columbia who've really profoundly impacted my career and enabled me to do the work that I do. So first, I want to start by saying thank you to the best cohort ever, my PhD cohort, who's provided inspiration and support since 2013. And then I'm going to go through some of my mentors. Buckle up, this is a long list for a very short time. So first, Dr. Lucine Pagosian, who told me what a PhD in nursing is and essentially made me become one. Dr. Elaine Larson, who helped me through my dissertation and let me do it in the Dominican Republic. We spent many, 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 many days at 5:30 in the morning writing that dissertation. Dr. Arlene Smaldone, who helped me get through the PhD program despite a head injury and leaving me with many pearls of wisdom that I now share with my own PhD students. My postdoc advisor, Dr. Rebecca Schnall, who helped me publish my first paper, turned me into a grant writer, and wrote me, I'm guessing, 10,000 letters of support. My K mentors, Dr. Tuandra Raul Consolo, Jianfeng Liu, and Maureen George. Maureen still supports me with qualitative analyses, and I call her a lot. My visualization mentor, Dr. Adriana Arcia, who taught me about information visualization and is still a close colleague. And last but not least, Dr. Sue Bakken, feeling very emotional, who helped change my life forever. She accepted me as a postdoc, let me do my research remotely before remote work was cool. And she let me do that in the Dominican Republic. She taught me about informatics and continues to provide career guidance and mentorship and nominated me for this award. So I'm forever grateful to all of you for turning me into a nurse scientist. It's my honor and privilege to serve in this role and to contribute to the evidence base that's so acutely needed to reduce health disparities and improve health among those in need. Thank you.
Congratulations, Samantha. Our next awardee, Dr. Lucinda Canty, was selected for the Distinguished Alumni Award for Nursing Practice. Lucinda Canty, nurse, midwife, and educator, has made significant contributions to improve the maternal health of Black women. She earned a Bachelor of Science in Nursing from Columbia University in 1991. Dr. Canty has many years of experience as a nurse midwife and continues her work at Planned Parenthood of Southern New England, New Haven, Connecticut. Furthermore, for more than 15 years, she was nursing faculty at the University of St. Joseph in West Hartford, Connecticut. Currently, she is an associate professor of nursing at the University of Massachusetts, Amherst. Dr. Canty's scholarship focuses on mitigating Black maternal health inequities. During her doctoral study, she established Lucinda's House, an innovative maternal health initiative to address racial disparities among Black women. This project provides education, support, and social networking to Black women and their families in collaboration with the community. To examine racism in nursing, Dr. Canty offers monthly conference platforms entitled Overdue Reckoning on Racism in Nursing. More recently, she was selected to be a member of the National Commission to Address Racism in Nursing. Dr. Canty, a fellow of the American Academy of Nursing and the College of Nurse Midwives, has disseminated her research through multiple peer-reviewed journal articles and book chapters. Furthermore, she has presented her research at state, regional, national, and international conferences. In recognition of her commitment to improving Black maternal health, educating the next generation of nurses to consider their biases and the biases of others that can negatively impact the health and well-being of marginalized communities, we honor Dr. Canty with the Distinguished Alumni Award for Nursing Practice.
I realize it's been 33 years, and this is my first, I feel sad to say, my first reunion. But hearing what the school is doing, how things are moving forward, this is not gonna be my last. So, and I don't even know why it took me so long, because when I reflect back, I had such good experiences. And I say that as a young Black female who came to a city. I live in Connecticut, but I did cry because I told my mom I'm leaving home, and she was like, "You're only 2 hours away." So I was like, I got over it because I knew it was a quick train ride home. But I was so young. 33 years ago, I was about 5 or 6 years old. Yes, only kidding. I was 20 years old in this big city, but I felt safe here. I felt community here. And I knew I wanted to become a nurse, but here is where I felt like I knew and understood what it meant to be a nurse. And I also realized I want to become a nurse midwife here. I didn't know about midwives until I came here. I was set to go into the newborn ICU. I had my a capstone at Lenox Hill Hospital, and I loved it. But I saw a birth in the hallway, and it was a woman jumped in and helped deliver this baby. And they were like, she's a midwife. And I was like, that's what I want to do. And I ran home. I told my dad, I'm going to be a midwife. And he's like, how do you think we got here? We were all... So I felt like it was my destiny. And I just want to thank Heather Reynolds, a midwife at Yale University, nominated me along with Dr. Peggy Chin and Dr. Roberta Waite of Georgetown University. And you just get used to doing the work that you feel like this is what I was made to do. And I feel like Columbia gave me that foundation to go on to become a nurse midwife, to become a researcher, and to work in the community. So I'm just really grateful to be here today. Okay, thank you.
Thank you and congratulations, Lucinda. I would like to invite Dr. Stephanie Wright to present the next two awards.
Good morning. This year we have two recipients of the Distinguished Alumni Award for Nursing Education. So the first one is Dr. Carolyn Sun. Carolyn Sun, adult nurse practitioner and nurse educator, is a leader in using informatics to improve quality of patient care and improve health outcomes. Dr. Sun earned a Doctor of Philosophy from Columbia University in 2015. In 2016, she also completed postdoctoral training at Columbia Nursing in Global Health. As a certified nurse informaticist, Dr. Sun's research focuses on using informatics methods and tools to improve health outcomes and quality of care for patients with chronic diseases such as heart failure and diabetes. She has received funding from the National Institutes of Health, the Agency for Healthcare Research and Quality, and the Robert Wood Johnson Foundation to conduct innovative studies on telehealth, mobile health, and artificial intelligence. Furthermore, she has disseminated her research through several book chapters, numerous peer-reviewed articles, and has presented at conferences locally, nationally, and internationally. Dr. Sun, a fellow of the American Academy of Nursing, has been elected and appointed to numerous positions within the American Medical Informatics Association, including chair, Nursing Informatics Working Group, member Pathways in Nursing Committee, and the Informatics Summit Scientific Program Committees. Dr. Sun, an assistant professor at Hunter College Bellevue School of Nursing, developed a course to educate nurse practitioner students about the impact of climate change, structural racism, and politics on global population health. This course included an immersive experience for students in South Africa, facilitating students learning about a new culture in the global South. In her teaching, she is committed to issues of social justice, diversity, and equity. For her significant contributions to using informatics to improve healthcare, integrating innovative teaching in nursing education, and mentoring the next generation of nurses in global health, we honor Dr. Sun with the Distinguished Alumni Award for Nursing Education.
Thank you so much for that speech, I felt like I got a promotion from all the things you were saying. I just wanted to say thank you to Columbia University School of Nursing and all of the lovely colleagues and mentors and friends that I have made here, particularly Dr. Larson, who is my advisor, gave me such amazing opportunities to do research in Southern and Eastern African countries and the Eastern Mediterranean region. I felt very honored to be awarded at the same time as Dr. Dorn, who also worked with me to do a lot of those things, and I wish she was here, but I feel special that we got it at the same time. I also want to thank Hey Fern, who's not here, but who assisted me in so many things. I can't even say how much she does, but she's such a hard worker. I wanted to thank other mentors that I've had. Dr. Stone, who helped me get one of my first grants. I wanted to thank Greg Alexander, who's been a mentor to me since I left Columbia, but he's here now. I am very grateful for my cohort that I graduated with. Dawn Boyd is here, I saw, so thank you, Dawn, for your support. All through our program, we would say to each other every day, we would be like, "You are the best and the smartest." It was like our way to encourage each other. And I'm really grateful to Dr. Berkowitz, who's no longer here, the former dean who gave me my first job, and to our new Dr. Frazier dean, who also gave me a job and helped me get started in my career. I feel like I have so many people to thank and so much gratitude in my heart. And I want to thank my friends and my family for their love and support. And thank you all for, and I saved it for last, and I almost forgot, Dr. Sue Buchan, especially. She's the one who nominated me for this award, and she has been a really wonderful mentor and support for me, both here at Columbia and beyond, and I really appreciate her. So thank you all.
Our second recipient for the Education Award is Dr. Jared Cutson. Jared Cutson, a certified healthcare simulation operations specialist and educator, is a pioneer in simulation-based education. He earned a Bachelor of Science in Nursing from Columbia in 2005. Dr. Cutson is an associate professor of emergency medicine and medical education at Mount Sinai School of Medicine and Mount Sinai Hospital, and senior director of the Simulation Teaching and Research Center. As a leader in simulation, he created the first virtual escape room, which has been used in both nursing and medical education. I want to go to this escape room. Dr. Cutson currently serves as president-elect of the Society for Simulation in Healthcare, the largest multidisciplinary international simulation society in the world. More than 10 years ago, he led the development and implementation of the first certification in simulation. Globally, over 4,000 individuals have been certified in simulation, education, and operations. This certification is approved by the Society for Simulation in Healthcare and also by the Magnet Accreditation for nurses working in hospitals. Dr. Cutson is a fellow of the American Academy of Nursing and the Society for Simulation in Healthcare. He also serves on the New York State Board of Nursing and the New York State Emergency Medical Services Council to ensure that simulation education in New York can provide clinical hours for nurses when taught by certified individuals or at accredited facilities. In recognition of his leadership in curriculum design, innovative teaching methods in simulation-based education, and disseminating his scholarship through presentations and publications, we honor Dr. Cutson with the Distinguished Alumni Award for Nursing Education.
So if you ask my parents who are watching virtually, this is not their son getting this award. They're not sure who you read about. 20 years ago or so, I was sitting here at Columbia. I was texting a friend and we said, where did those 20 years go? And I distinctly remember sitting here. I don't remember if it was Judy or Mary, Karen or Christine Gebby, who said, we are giving you the tools on your tool belt. It is your job to go out and figure out how to use them in the future. And I was not a great high school student. Skated by in college, and I found myself here at Columbia, which really set me on the trajectory for the rest of my career. After Columbia, I went on, got a master's degree, got a DNP up in Massachusetts, and have found myself immersed in this world of simulation-based education. And there's been a number of mentors along the way. Jenny Rudolph up at Harvard, Chuck Posner at the Brigham and Women's Hospital, KT Waxman out in California. But it was the foundational and underpinnings here at Columbia that provided me that opportunity. Without that solid foundation, without being set on that trajectory to learn about what a nurse scientist is, about the impact that you can have in the larger community, none of what I've been able to accomplish would have been possible. So it's really due to those 4 individuals, many others along the way as well, but here at Columbia. And you know you've made it when I can say their first names and you know who I'm talking about. So thank you all very much. It is an honor to be here with my fellow recipients. And last but not least, I'd like to thank my family, my wife Melissa, my 2 children, Sylvia and Eli. They give me a ton of practice with debriefing and simulation-based education at home. So thank you very much.
Okay, thank you, Jared. I want to call back Maureen Murphy-Ruocco to present the last award.
Thank you, Stephanie. I will now present the Early Career Alumni Award, Emerging Nurse Leader. Dr. Alum Tark, family nurse practitioner and nurse educator, is a leader in palliative and end-of-life care. At Columbia University School of Nursing, she earned a Master's of Science in Nursing in 2016 and a Doctorate of Philosophy in 2019. Dr. Tark, a certified hospice and palliative care nurse, has worked as a registered nurse in pediatric oncology, hematology, and bone marrow transplant at the New York Presbyterian Morgan Stanley Children's Hospital. After becoming a family nurse practitioner, she gained experience in urgent care settings and at the Hematology, Oncology, and Therapeutic Infusion Center, Mount Sinai West Hospital, New York. Currently, Dr. Tark is an associate professor and director of the Family Nurse Practitioner Program at Columbia University School of Nursing. As nursing faculty, she teaches and mentors students at the graduate level. Dr. Tark has received several awards for accomplishments in clinical practice, in research, and in education. She regularly serves as a reviewer for leading palliative care journals and has disseminated her research through publications and presentations. In recognition of her ability to build effective interprofessional healthcare teams, utilize evidence-based research to guide clinical decision-making while improving end-of-life care, and serving as a mentor to family nurse practitioners, we honored Dr. Clark with the Early Career Alumni Award, Emerging Nurse Leader. Dr. Alum?
It is my incredible honor to stand before you as a recipient of this award. It is filling me with joy and gratitude and also humility. Before I continue for the next 2 hours, I must share this personal sentiment with you. I am feeling so much joy and gratitude, but I wish my dad was here. But at the same time, I know that I'm carrying him with me everywhere I go in spirit. and he's watching over me and smiling down on me from the best seat in the club. I'd like to express my heartfelt gratitude for the mentors who really, their unwavering support and guidance really shaped my journey. And I know two of my amazing mentors are watching, so I wanted to just tell them that I am very grateful to be here, and if it were not for my mentors, I wouldn't be here today. As I'm standing here and looking around, the room is filled with faces of wisdom and love, kindness and knowledge, and the care. So each and one of you are really representing the individual that I want to learn from, that I learned from, and I aspire to get to know so that I can learn from you. This really reminds me of the fact that nursing journey is never completed. I must continue to learn from you, learn from all the experiences, and even from my mistakes. This award is not a testament to my own accomplishment and achievement, but also it is a reflection of a collective compassion and passion and our tireless work to advance the field of nursing and field of nursing science, also nursing practice. To the Columbia University, thank you for providing me with the knowledge, with the education, and with the tool that I'm quoting from the previous awardee, that the tool belt that I have that's filled with what you taught me from this institution. Thank you for this incredible work. And lastly, let's continue to make this world more compassionate and more caring and healthier for all. Thank you.
Thank you, Alum. It was such a pleasure to celebrate the 2024 Alumni Awardees. We applaud all their contributions to the nursing profession. We will actually be going on to the next session, so if you need to use the ladies' room or whatever, but we'll be going right into the next session. Thank you.
I'm gonna go. Yeah. All right, everyone, welcome back. It's a pleasure to be here today. My name is Ian West. I'm a current Psych DMP student, as well as a 2022 graduate of the MDE program. I'm joined by my fellow alumni, Mary Germain, class of 1964, Janet Reddy, class of 1981, and Jared Kutzen, class of 2005. This program is nursing and perseverance throughout the decades, and we're going to touch upon the tenacity that we've all experienced throughout our time in our nursing careers and education. Whether you are a current student or a seasoned nurse in your career, I'm sure every single one of you can relate to the term nursing burnout and how it has affected you at one point throughout your career. However, I know we can all agree to the fact that nurses are strong and resilient, and we find ways to push through. Perhaps it was times with your peers while in school, making friends at work, or something you've incorporated into your life, such as yoga, that gave you a sense of balance and put a smile on your face during these trying times. Mary, Janet, and Jared and I all represent a different time throughout nursing history, and we and we look forward to sharing our different ways in which we have helped ourselves and our colleagues, and hopefully give you some good laughs and memories to take along with you. Thank you, and I'll turn it over to Mary.
Thank you, Ian. Is this too loud or okay? Okay. Welcome to Frogland. Sorry about the voice. But yes, I'm one of the dynamic dinos from the class of 64, so we go back a long way. Yes. And we were fortunate enough to go to school when, one, we had Maxwell Hall, so we all lived together for 3 years. And when you do that, you form friendships that lift you up for the rest of your life. We also were fortunate, those of you around our age will remember the wonderful textbook of medicine, Cecil and Loeb textbook of medicine. And there we had Betsy Loeb, his daughter, as one of our teachers and supervisors. I mean, how good does it get? She expected a lot, but what you learned was phenomenal. And I think we also were very resilient by the time we graduated. I mean, as juniors, you would be the nurse, well, the charge nurse, or you would be in charge of a 32-bed ward in the first semester of your junior year. And we spent at least 32 hours a week in clinical practice. You do that, it gives you a level of resilience. And we were fortunate enough to graduate, I think, into a healthcare system where we had to make sure the docs knew we were no longer going to stand up when they walked into the nursing station. Forget about it. But we built colleagueship and collaboration, and nurses were very, very valued. We didn't have the conglomeration of great big healthcare systems that you do now. So it was, our transition into practice, I think, was much easier than it is for the nurses, the young nurses today, and many of whom I'm very glad that we had. And we also had enormous energy as a class, as you could tell from the black stockings and the balloons this morning, because the night before we got to wear our white stockings as seniors, 142 of us stayed up all night, blew up blue and white helium balloons, attached our stockings to them, and we went out 142 strong, the front of Maxwell Hall, and let them loose into the air. We could not do that anymore. Yes. I'm glad the FAA didn't go after us, but that same energy also led our class to form Alpha Zeta, our Alpha Zeta chapter of Sigma Theta Tau. So the energy was put to some fun uses, like we used to, they had these 5-gallon, these are the things that kept us going as students, sunbathing on what we called Tar Beach, the top of Maxwell Hall. And at that time, the Maxwell Hall had a wonderful, well, not a cafeteria, well, I guess a mini cafeteria where we would eat, and they had big 5-gallon tubs of ice cream they would serve us from. Well, we found a way to get into the kitchen at night and bring a few of those tubs up to where we lived. That was short-lived. Miss Gill made sure there were corrugated steel doors on the kitchen after that, yes. But the wonderful experience we had, I think, turned us into very resilient nurses, and I think all of us appreciate, for the young nurses coming out now, you have to build an inviting environment for them. You have to help lift them up so they feel comfortable learning some of the complexities that we were fortunate to learn as students. And the nurse residency programs that exist now and the magnet hospital recognition programs like that, I think, have helped to spur the development of programs that lift up the new nurses who have so much to offer. And we need to move forward with our beloved profession and provide as much support as we can and add humor to the new nurses. When I became faculty as well as a clinician, and was fortunate in the late 80s to start the graduate program at SUNY Downstate, I soon learned that you can go to meetings where you think, are you out of your mind? Everyone is so tense. This is not going to happen. So I developed wonderful cards, wonderful business cards, in addition to my regular card. Yes. You hand one of these cards across the table when everyone is at everybody else's throat. And yes, it works. And I have more of these if anyone would like some. On to the next. Humor does it.
Hello, everyone. When Janice asked me if I would speak today, I said I will always serve Columbia University School of Nursing. I didn't know when I graduated in 1981, and I say that and I pause because this morning as I sat to compose some thoughts, I actually pulled out my calculator and said, was it really that many years? And it is, and it goes by so fast. But what Columbia does, the School of Nursing does, it absolutely creates nurse leaders. When you're becoming a nurse leader, it's somewhat transformative, and you don't even understand it. I had no idea I was a nurse leader. I think it's in the water at Maxwell Hall. I think that's where it starts. Some people put fluoride in water. Leadership is in the water. I was at Maxwell Hall, and I just want to call out to Midge and Sally, who I was with last evening at the Board of Advisors. I want you to know that when I lived in Maxwell Hall, I was on the 10th floor. We didn't have a beau parlor. I lived on a co-ed floor. Men lived on the floor with me, and we just segregated our bathrooms. So Columbia has really changed and has led a lot through the years. From nursing practice in the 80s, in many ways, it was similar to what you just heard. I would go on a nursing unit, and I'd be the single nurse. I'd have 32 patients, at times 36, one nurse, two aides. The aides would split the floor, and we'd work all night long, nonstop, absolutely nonstop. We'd have medical patients, we'd have surgical patients, and one time I got a post-op OB patient who had a DNC, and her IV solution was running low, so I had to get the pharmacy to get me Pitocin. We had PDRs. We did not have medication safety or meds barcoding. The tools we have today are so beneficial to the practice of nursing, but we didn't have them at the time. So running my floor, I went and I had the nursing supervisor, because we didn't have pharmacy, bring up Pitocin. Didn't get a chance to make sure it was right in the PDR. I hung it after I found IV solution. A couple hours later, I'm thinking, I wonder if Pitocin and Pitocin are the same thing. There you go. Do you know what that does for a young nurse? I called the nursing supervisor and I asked her, I said, I think I hung the wrong medication. She said, no, dear, you did not. I then went through a bin this tall and found the vial, and I had it in my hand, and I called her back. I said, no, I hung Pitocin. She goes, I know, dear, I'll be right up. So medication barcoding, the tools that we have today are absolutely priceless to patient care. That experience made me almost step away from nursing. I've stepped into nursing more fully. I was a bedside nurse for several years, and I went from individual patient care to caring for communities at large. The majority of my career has been spent in the C-suite. I went from patient-centric care to community-centric care, and patient safety, clinical quality, excellence in patient experience in all we do really drives financial performance in a healthcare organization. And I've led at least 4 healthcare organizations, and never did I think that I'd ever be a nurse leader and incorporate all that I do as I led organizations that were maybe $140 million to $800 million, employees from 600 to 3,500. Never did I think, but all I do is everything I do, I put through the lens of nursing. I always look at the patient's perspective first and foremost. And being a Columbia nurse is second to none. So I thank you for the opportunity to speak today. And I will pass it. Oh, and the other thing that changed, we no longer used caps. We got rid of our nursing caps in the 80s. Very, very important. And I heard some didn't even get pins. Yes, BSNs did not get pins in my colleague's generation. I am a BSN. I have my Columbia pin. And I appreciate it. So your turn, Jared.
My clinical background, so I worked in emergency departments in Massachusetts and in New York and in New Jersey. And when we were asked to talk about resilience, I go back to thinking about my time here at Columbia, my time working clinically, and my time today. And besides ice cream, which is a really important component of building resilience, I do think, I think it's about what Janet was talking about, the community that you surround yourself with. I distinctly remember really challenging times here at Columbia, and I would call upon my colleagues and my cohort, and we would talk about the program. We were all in what was then called the ETP program, the Entry to Practice program, where it was an accelerated bachelor's, and Mary Moran standing in the back shaking her head, faculty member of mine back then. And we would struggle, and we would all sort of collectively get together and lift ourselves up. And whether that was going for a run in the park or going to the bar at night or whatever it was that we were doing, it was about building this sense of community. And when I was working in the emergency department up in Massachusetts, it was difficult. There were challenges, there was staffing, there was mass casualty incidents and pediatric patients that we had to resuscitate. And at the end of the night, when we were getting off of work at midnight, I found myself not going to the bar with my friends, but going for ice cream with friends. And you surround yourself with those people that will support you throughout your career. And today I see new nurses. So yesterday I had a cohort of nurse fellows working in the Mount Sinai Health System. They are brand new nurses who are entering into the emergency department. For those of you who don't know, up until about 2 years ago, New York State had a law on the books that said new nurse graduates could not work in the emergency department. You must have had 1 year of experience on another unit so that you can then function independently in the emergency department. That law was repealed, and so now we are able to take new graduates into the emergency department, but we need to get them up to speed. We need to give them competent, or at least advanced beginner, I hope. And we need to make them comfortable with working in this environment. But what we spend so much more time focusing on is how do you function as part of a team? How do you communicate with each other? And how do you build that social support and social network for you to be able to sustain yourself in this career? So just yesterday, I had a new cohort of them, and we give them an article to read. It's called, I think it's Death at 1:15 and Life at 1:30, What It's Like to Be an Emergency Nurse. And we didn't get a chance to discuss it yesterday, but we brought it up, and they said, reading that and reading one of the other articles you gave us about the new graduates in the emergency department was so helpful because it grounded our experiences and gives us something to build on. And I encourage them to go out and find that community of support with each other, with the other nurses that they're working with the other respiratory therapists, the physicians, the med students, because I think what somewhat has changed over the decades, as we heard about, was the complexity of care and the need for us to work collaboratively with other professionals. It was always there, but I think today, in the span of a day, our patients are coming into contact with upwards of 30 different health professionals. The nurses are turning over, they're covering different people. So I think finding that support system, because I too made a medical error when I was a new nurse. And if it wasn't for the charge nurse and the nursing supervisor to say, it's okay that you gave 12 units of insulin versus 2 units of insulin. What's worse is if you don't tell anybody. And if they don't make the environment comfortable for people to speak up and work collaboratively in, that's when other mistakes happen. So I think it really is about building that network, building that community of practice so that our new nurses feel supported in the good times and in those challenging times.
Awesome. Thank you guys for all sharing. So some themes that kind of really resonate with me, and I think hopefully resonates with all of you, is that, like, despite 60 years separating all of us, like, this leadership quality, and like we talked about that earlier with Dean Frazier, kind of talked about like the school and the direction it's going, is like the nurses that are graduating here, they're not just nurses. They're called to do more. They're called to become nurse leaders, change healthcare. So this kind of brought up my story. I think it's very funny. So I did my clinical rotation when I was in the MD program at the New York State Psychiatric Institute. I had a great time there and got a job out of it. So I started, back in 2022. And I, of course, because like I had such great memories in the MD program, I brought some of my colleagues with me. I was like, hey, like, it's this really cool place that's hiring. It's per diem, so if you're in the doctorate program, it's a great way to flexibilize your schedule. And so we started working there, and we had a great time. You know, we were learning, we were growing. And I remember it was probably like maybe a month after we were off orientation, so we were still very novice in our skill set. And we were working the evening shift. And I remember going in, and our nursing supervisor came and said, hey, so the other nurse, the full-time nurse, called out. So I've got 3 of you guys, and you guys are going to cover the unit tonight, even though you guys just got off orientation about a month ago. But her response was, but you guys will be fine. You're Columbia nurses. Like, you got this. So we looked at each other, and we were kind of like, okay, good. I mean, that's true. We are Columbia nurses, so we'll figure this out. And it's just like, yeah, it was like one of my favorite memories, just thinking about kind of like how we had to kind of piece it together. I still joke with my colleagues about it because like I went around and I was like, okay, like let's draw straws to figure out who's going to do meds, who's going to do charge. And before I could turn around, the other person's like, I'm doing meds. So you'll be in charge. So that's a kind of funny story. And then think about the education, as we kind of touched on earlier with like leadership and how that kind of incorporates into the educational process here. I think thinking about, you know, the educational journey and how you're not just taking classes to memorize stuff to become like an expert in med surg or your specialty area, but you're rather like taking classes that are going forward to say like, hey, these are the skill sets you're going to need to lead people and to make change happen. So I'll bring up another funny story, kind of a resilience. So my sister just graduated from PA school this past December. She took a job out here at NYP on a transplant team. So whenever we have dinner, of course, with my mom, we always have to bring up, well, NP school is way harder than PA school. And then she'll counter back and say, well, our clinicals are way tougher than yours. So we have like a nice back and forth with that. But I think it really encompasses like how diverse the education has gotten. Even over the 60 years, I think leadership's still there, but like the change within that. And then kind of with my last point, interdisciplinary, I think we touched on it a little bit, but I think that's something that we're seeing a ton more. And it does make it stressful for nursing because you're not only learning how to work within your specialty area of being a nurse, but you're also having to work and like, how do I manage physicians? How do I manage techs, assistants, all that? And I think that's where it becomes complicated because you're not just in your own silo anymore. You're having to really go out and work with cross-disciplinary lines and say, like, hey, like, we have the same goal. We need to make this person better. And how do we do that? And so we have to work together. And of course, I'm biased because I think like nurses are the best person for that. I mean, I think we know how to bring people together and figure out their strengths and get them to, you know, get the unified goal done. But I just wanted to thank everyone for attending this panel, and I'm going to turn it over to our next speaker, who is going to present, Dr. Letitia Hanton and Dr. Prieston, and they're going to talk about the client or the clinician as the client, and it's going to kind of touch on this interdisciplinary aspect. So thank you.
Thank you very much for the wonderful panel. We are going to piggyback on all those wonderful, resilient experiences that you had, so important. And I'm Dr. Pat Prieston, and I am an occupational therapist, and I teach occupational therapy across the street at CUIMC. I'm also a psychoanalyst, and this is Dr. Letitia Hanton, and you know her. She is the director of psychiatric DNP, and she is here to us, with us today to give this presentation on clinician as client, how to take care of ourselves. Now, we have another colleague, Dr. Phyllis Simon, who is also an occupational therapist, who couldn't be here today. So how do we know each other? We are involved with each other because of a wonderful grant that we have together. It's an interprofessional grant, and it offers our nursing students and our occupational therapy students stipends for coming to us and learning about trauma-informed care and trauma treatment, and then going to underserved communities around here and providing trauma treatment and trauma-informed care to the agencies that they serve. So it's a wonderful opportunity, and in working with these students and in this capacity, we realize that in working with people who have psychological trauma, we can also be traumatized. We know this from school, we know this from clinics, and we think it's very important to teach also how to take care of oneself. So today we're going to talk about examining the definitions of secondary trauma and compassion fatigue, identify signs and symptoms of burnout, examine the concepts of gratitude and how it might mitigate burnout in the workplace, provide strategies for prevention and intervention for personal and professional wellness, and finally gain insight and strategies on how to build and promote resilience. So let's start with secondary trauma. This is indirect exposure to trauma through a firsthand account or narrative of a traumatic event. I think almost everybody in this room can understand that there are traumas all over the world right now, and everybody has been affected by them. So it doesn't mean that you have to be present. You could see it on the news, you could read it in the paper. Everyone's different. Some people develop secondary trauma, some people do not. Some people are resilient, more resilient than others, some are not. So we just have to be aware of ourselves and our signs and symptoms, which we're going to get to in a second. So secondary trauma can affect anyone, and certainly teachers and therapists, mental health workers, child protection workers are well posed to hear traumatic stories, to see traumas. All healthcare providers, first responders, paramedics, police officers, firefighters, children of traumatized parents, right? Family members or intimate partners of traumatized individuals, and many other occupations that aren't even listed here. Journalists, jurors, lawyers, researchers, and insurance workers, etc. Some we don't even think of. So it's very important to recognize your signs and symptoms. So as I go through some of these, ask yourselves, you know, have I experienced this? Am I experiencing this now? And or what would I do if I was teaching or helping people in the clinic, new people, new to this profession? Be aware of their own. And as was said before, be comfortable talking about their signs and symptoms, because that's the best way, is to prevent, right? And you can't prevent unless you become aware. So feelings of numbness or feeling detached, feeling overwhelmed or hopeless, physical fatigue or low energy, and these are all signs and symptoms that may come on slowly or all at once, but were not necessarily present in your personality before, okay? Behavioral changes. Have you changed your routine? Are you starting to smoke? Are you starting to drink? Are you drinking coffee where you didn't drink coffee before? Are you starting to do yoga? These are all signs that there's something going on, that you feel that you need to do these things. No judgment. Are you engaging in self-descriptive coping mechanisms, such as you know, employing things that you may not have done in a long time, like journaling, etc.? Professionally, all this anxiety and stress and anger and feelings around having secondary trauma can cause low performance in your job tasks and responsibilities. And so often students and professionals suck it up, try not to show it, don't want to be weak, want to be the best. And this actually can cause low job morale, fatigue again, because, you know, anger and anxiety just stop your creativity, and you expend a lot of energy trying to stuff anger and anxiety to get through the day, thinking that you have to. Some people are afraid to open up Pandora's box. If they go to a therapist, then all of this is going to come out and they feel they're going to fall apart. Now, cognitively, given this, of course, you would expect to see decreased concentration, difficulty with decision-making that was maybe easy for you before, traumatic imagery, dreaming of clients, having nightmares. It sounds awful. This is a continuum, right? It's not necessarily at the end of the continuum, but hopefully, you know, everybody has some of this ordinarily, but there's no threshold. It just depends on you. There's no threshold to cross when you can say to yourself, I have secondary trauma. Just something to be aware of. And interpersonally, some people under these conditions withdraw, physically, emotionally, etc. So again, prevention is the best way. How can we prevent this? Now, don't laugh, but if, you know, for professional strategies, try to balance your caseload, try to do whatever you can, utilize supervision. Don't be afraid to tell your supervisor, not only that you may have made a mistake, but tell your supervisor, you know, I don't feel well. It's getting hard for me to do this. And I can almost rest assured for you that your supervisor has gone through something similar, if they've had more experience than you have. So there's no shame in doing this. In most cases, your supervisor will be more than willing to help you through that. Clinical training, we consider this clinical training. We're opening up an awareness. We could go on forever talking about these things, but we're not going to. But there's so much more. There's PESI, there's all kinds of websites that you can look for helping yourselves and helping others that are experiencing traumatic reactions. Personal strategies, know your limits. Don't compare yourself to other people. It doesn't matter. What you're feeling is valid. and engage in self-care. So many times I've tried to talk to students about different self-care means, and they'll say, well, I don't have time. And I'll say, well, you don't have objective time. But the time that you spend will help you, whatever you're doing. If you're doing exercise, if you're taking a salt bath, whatever, yes, you're taking objective time, but it's going to put you in a better frame of mind to concentrate so you won't have to study for so long, or to be more present with your client because you won't be as tired because you worked your sleep hygiene, etc. It's an investment. Hard to convince people of that, though. It takes an organization, right? Because you can be doing the best self-care ever, but if you can't get time off and vacation time or release time, you don't feel safe in your physical space, or it's too small, or it's too crowded, or it's too much stimulus for you. It's a problem. So this is at an organizational level also. And of course, there are coping strategies that you can use. So let's go through a couple coping strategies right now. Just want to mention these because these are very good to help you with your clients and also for yourself, and they're quick, okay? If someone gets triggered with a traumatic response or a memory, they can go from 0 to 100 as far as their anxiety. So these are some things to teach people before that happens so that when they start to feel the first signs and symptoms of that, they can try to stop it. So deep breathing, we all know what deep breathing is, but there's a particular wonderful type of deep breathing that I usually like and other people like when I teach it to them. And it's the Ashtanga Yoga deep breath. And Ashtanga Yoga is a yoga that practices movement in an inhalation, then another movement opposite in an exhalation. It's like a dance, and it keeps going, but you have to breathe with it. And the breath helps you get into those difficult positions that if you stopped breathing in that position, you would probably fall over, okay, because the breath is so important. So the deep breathing has to do with taking a slow inhalation through your nose and a slow exhalation through your nose again. But you close your throat so that you're still getting air, but it's like a laser beam. The air is coming in like a laser, and then it's going out. And it calms your vagus nerve down immediately. And it only takes a couple times to do it, and you know you're doing it correctly if you're making that funny noise, which I'm going to make for you in a second. And the reason I talked about the Ashtanga Yoga is because you can do this breath while you're doing something complicated like getting in a yoga position. It means you can use this breath when you're working with a patient. You can use this breath while you're doing other things, and it still works. So here it goes. You have to make this noise. So you're breathing in. After one breath, I honestly feel more relaxed. So you can try that. Now, a fake yawn is next. We all know that people yawn when they're anxious or tired, right? Some people are yawning now, thank you. It's the power of the mind. So what does a yawn do besides decrease anxiety and wake you up? Well, it increases circulation to your face. It relaxes your eyes, and it also counters the quick, rapid breath that you would have when you get anxious, that I'm anxious, right? So try a yawn, just fake it. Again, more relaxed. It's also, you're taking a deep inhalation and a complete exhalation, and that's what's working also for you. Now, energy. I am an energy worker. I believe in energy in the etheric field, and the body physically, when it's under stress, especially deep stress, when you're in flight mode, the blood goes to your thighs so you can run away. And that means it leaves the hands, leaves the extremities, and gets into the big muscles. So your hands get cold. So now we're going to fake our body into warming our hands. And guess what? That's relaxing too. So whatever you do, you breathe on your hands, you warm them together, you make an energy ball inside your hands, and you're calming yourself. Again, just a couple of minutes. It's something normal that you would do, and you can teach your clients to do this. Tapping is a little bit more involved, so we're only going to tap on the tapping, or just touch on the tapping. Tapping is providing certain stimuli to your pressure points as like acupuncture pressure points. So there's a couple I'm going to show you. maybe Letitia can do this for you because I have a microphone in my hand, but there are K27 points, and so you're going to find them. They're right below your, 2 inches below your collarbone, and you're going to take your hands and make like a duck face with your hands, cross your hands, and tap on those points. And as you're tapping, you're going to say nice things to yourself. I love myself. I'm a good person. I work really hard. I care about people. People love me. It's a wonderful day. I'm going to create the best day ever, etc. Okay? And you do that about 15 times. Then you go to your spleen, which is right here. And you do the same. You don't have to cross your hands, but you can tap with 2 hands on your spleen, say nice things. The last point is right here, 2 of them. And those points are your lymphatic system, and you're stimulating your lymphatic system and saying nice things. Now, that's just the surface. There's many other tapping mechanisms for if you've had trauma and you're reliving the trauma in your head as you're tapping. That's a whole nother thing, but it's the same principle. Now, holding vascular trigger points. This one is easy to do. It involves your forehead, and you take both your hands and you put pressure on your forehead and you slide your skin to the side. And you hold it. And you do that for a couple of minutes. And what that does is it brings the blood to your frontal cortex. It stimulates your frontal cortex. So if you're having an emotional reaction, it's moving the blood from the amygdala and hippocampus to your frontal cortex. So if you've ever seen people in a meeting or studying, you've seen students put their hand down like this and they're going like, they're holding their head up, not necessarily because they're tired or have a headache. They're stimulating their brain to function better in the frontal cortex, right? Next time you go to a meeting and you see people sitting like this at the meeting, or like this, they're stimulating relaxation points. Okay, so those are nervous people. Do you see people relaxed in a meeting, have an open posture, don't put their hands on the table. People who are a little bit more nervous put their hands on the table and do these kinds of things, okay? So, the other thing is to open your jaw wide, and that just mimics the fake yawn. We don't need to do that again. But all of these are geared towards calming the nervous system, specifically the vagus nerve.
We all know compassion to be the cornerstone of our nursing profession, and occupational hazards come with any profession. If we were working in construction, for example, an occupational hazard might be hearing loss. So we, as nurses, we know and understand some occupational hazards, for example, infection control. If I say to anyone in here what is protocol or what is procedures for infection control, everyone will have an answer. But are we as sure when it comes to our emotional health? Do we take the time to say when we're overwhelmed, when we're stressed? So compassion fatigue is when we've reached that point. And we're going to go into a little bit more about that. Press this one. Okay. So this is a decrease in empathy that we might have after working with individuals that have been through trauma or individuals that have been dealing with stress, and it can result in us having burnout. Secondary trauma, as we mentioned, is one of those as well. And part of it is going to be noticing that this is a normal reaction that we would have. So everyone is going to have compassion fatigue, and even if you try not to have it, it's still a process of what we do and process of using our empathy. So it's a normal. What makes it abnormal is the circumstances that it occurs in. So for example, when we have a heavy caseload, when we have too many patients, when we're in a stressful environment, like some of the panel had mentioned with medication mistakes. These can cause us to have compassion fatigue because we're feeling overwhelmed in that moment. Also, when we have exposure to individuals that have high mortality or exposure to people that are suffering or have had trauma, for example, COVID-19, these can cause compassion fatigue as well. The compassion fatigue cycle looks at when we first start off, we may be overzealous. So these are the individuals that are volunteering, you're enthusiastic about working in the environment. You might say, okay, I'll take that Saturday, I'll work that shift for someone. However, once we start building some of this compassion fatigue, it can result in us being irritable. Like, why am I always the one that has to do this? Why is this medical record not working? Why am I starting off with all these documents that I have to put in? And this can lead us to then withdraw, like feeling as if, well, what's the point? It's always going to be something to do. I'm always going to be here until 8 o'clock at night finishing up this paperwork. And that might lead us into zombie mode, which I seem to call similar to like being on autopilot, where we're just going through the motions, we feel overwhelmed, and that might then lead us into going from there 3 different pathways. So one would be if we develop compassion resilience, and now we start to say, what I'm doing is not working, I'm overwhelmed, and I take some steps to now rectify that. The other would be I leave. I realize that the profession is too much, and I decide this is not for me, and we noticed this with COVID-19 as well, when we had a huge reduction in nurses because of leaving the nursing profession. And then the other might be to go back into that and becoming more anxious and becoming more involved in terms of the zealot. The next one is looking at compassion fatigue in ourselves. So if we think about ourselves, how do we think compassion fatigue shows up? It could be that we feel some of the emotions that Dr. Prieston mentioned earlier, like having anger. It might be intolerance to others. It might be cynicism, feeling as if we're bitter or resentful. It could be problems with interpersonal relationships. We recognize that we're no longer as tolerant of someone when they make a mistake. It could be the cognitive difficulties that were mentioned, like I might not be able to focus. I might feel as if I'm overwhelmed, and I might be forgetting things and saying, you know, what was wrong with me? Why did I make that mistake? Physical health can also play a consequence. I might now, because of the high cortisol, I might have diabetes, I might have more pain, I might be reporting that I have headaches, stomach aches, so we might see some physical complications. So I just wanted us to think for a moment and say, you know, how do we think this shows up for ourselves? Okay. The other way I see it is that sometimes we might think like, why am I having this patient? Or this patient that's showing up again, we might feel like a dread for a certain type of patient or a certain situation that we find is uncomfortable. And this could also lead us, as we mentioned, to have increased illness. So we might notice that there's one coworker that's always out sick. That it seems like every time I turn around, I have this also with my students, that someone this week they had COVID-19, the next week they have GI upset, the next week they have headaches or migraines. So this might lead us to be overwhelmingly sick. And then where do we see it in our organization or in the places that we work? So just some thoughts for us. The next one is looking at the stages. So if we can acknowledge and recognize the information and skills that might help us to reduce compassion fatigue, recognizing and identifying when we are exposed to it, and then how do we respond to it? So building up some of the skills that we're talking about today. Mindfulness is one of them, being able to do exercises to recognize and stay in the moment. Self-care, as we mentioned, is another, when we can take the time to say, I need to have more time to sleep. Or I need to have, even scheduling in to go to the bathroom. Sometimes we get so overwhelmed that we're not even thinking about, did I go to the bathroom today? And in talking to colleagues, it might take some time to feel that we've handled a situation a certain way, and being able to share that with a colleague or share that with a peer, or having our own counseling. And building resilience is another way with responding to the application. So some of the ways that we can respond would be resetting our system. And there's a couple of articles that have come out about a technique called exercise snacks. So it's not the type of snack that we're thinking of like protein bars or like a food snack, but it's actually a snack that you can do in terms of quick burst of exercise for our body. So what I want everyone to do is, for a moment, if everyone could just stand, or if you're okay sitting, and then what we're gonna do is, for a quick couple of seconds, we're just gonna jump in place. And if we can't jump in place, we could just move our hands while we're moving in and just staying in space. Or if we're sitting, we can sit and move our hands too. Okay, everyone, thank you. So if you notice, you might feel a little energized after that. It gets our muscles moving, it gets our blood flowing. So even if we can't stand, if you're sitting and you're just moving your arms, if you're able to stand, and we can do jumping jacks. So usually 2 minutes It doesn't have to be long. I know whenever we hear exercise, at least for myself, I'm always thinking, oh no, I'm not in a gym membership and I have to now schedule this in. It's really only a couple of minutes. It could mean taking the stairs. It could mean that I'm going to take some time to do gardening. I'm going to take some time to do something around the house that I've been putting off. So it might be something we plan into the day. So that would be the exercise next. The other one would be stretching, music, considering if there's something that we enjoy, taking time to knit or crochet. So there's a number of ways that we can look at readying our system and being able to be more mindful. The other is thinking about gratitude. Gratitude shows up in a number of ways. And one of them is that there are people and events that we're thankful for, something that has been good to us, and we feel like we want to give recognition to it. So it could be a gift, it could be a person, it could be an action that's occurring. And why healthcare? Because healthcare is one of those areas where we very rarely hear, thank you for the work that you're doing. We very rarely say to ourselves, I'm doing a lot and I appreciate myself. There's also in other forms, and as Pat was mentioning, other professions as well where we don't hear enough. Thank you. So some of the things we might be thankful for, other people that we have. For example, if there's another nurse that we're working with, someone took a shift for us, family members in our lives. We might be thankful for even just saying to ourselves, I'm intelligent, I got here and I'm smart. Imposter syndrome is very important to recognize that sometimes people feel like I don't belong here. So being thankful for yourself and saying that I do belong here is also, it's gonna help keep us healthy in the long run. The next is looking at how gratitude can be helpful. So part of the reason why gratitude is so important, studies have looked at saying that we're thankful, saying that we're aware of thankful things has helped us to achieve more out of life, to have more helpful and generous actions towards ourselves. Also to increase happiness and to be ordered to be resilient. So the next one is we're looking at gratitude in terms of what it motivates us. So thinking about the connections that we make, problems can be less challenging when we have support and we have a person that we can connect with. It can help us to feel elevated when we talk about thankfulness and help us to feel humble. And indebtedness. We think of debt as most of us may recognize from loans and from the high cost of living that debt is almost here to stay. When we talk about psychological debt, is the emotional toll that takes us to places that we don't want to go. So it could be these intrusive thoughts that we have that I'm not good enough, or I could have done that better, or why did I say that? And being able to be thankful and work with people that we're thankful for can help us not to have as much of those type of thoughts that make us feel like we have a debt to pay with our mental health. Looking at our health using gratitude, it improves sleep, it helps us with our cardiovascular health, helps with mood and optimism. It can also help to reduce cortisol, helping us with decreasing fat intake. Some people may have sad thoughts. It could lead to suicidal thoughts when we have compassion fatigue and when we feel overworked. This is a part of our profession we don't often talk about, but gratitude is also shown to reduce those thoughts and help to reduce stress as well. Gratitude motivates us. I think I went backwards. Okay. Gratitude in the workplace. If we think about work and how often someone at work has said thank you to us, we might not notice that we've heard it all too frequently. So it might be nice, I think, if we did more of that at work. If we took the time, like if we're writing emails, I think it's almost common if we say, thank you for sending that or thank you for this. But how often do we stop by someone that we see in the hallway or a colleague that we're working with, or even thinking our patients? Do we ever take that time? Has anyone said to you in the last week, I appreciate you, I value you? And that can then make us feel like we have a reason for being there. We have an appreciation. So I even take time to tell my students, thank you for showing up, and thank you for being who you are. The next one is looking at, in terms of the workplace, how people have been thinking about gratitude in the workplace. So some people felt as if if we did say thank you, it was a sign of weakness. And what studies have shown is that's not the case. So 50% had never heard or rarely thanked anyone at work, and only 10% expressed gratitude on a given day. So is there someone that you think of now that you're really grateful for? And what I want you to do is just take a couple minutes, I know we're close to time, but just take a couple minutes and just say to your partner or someone next to you, something in your life that you found that you're thankful for. Okay, everyone, thank you. So thinking about the other part of compassion fatigue and when we feel overworked, it can lead to having burnout. And burnout was one of the reasons that many people left the profession. So 40 to 75% of healthcare workers, so it's not just us as nurses, it's a variety of healthcare workers as well that are experiencing burnout. We also don't talk about teachers and other professions as much that have been overwhelmed. For us, it can be the critical care nurses, oncology nurses, emergency room nurses were shown to have some of the highest levels, but I think it can affect any form of nursing. I'm a psychiatric nurse practitioner, and I can see it too in my colleagues. So before COVID-19, it was about 15%, according to one of the JCAHO studies, of nurses that had burnout, and now there's much greater positions and amounts of people. So gratitude is going to help us by being able to reduce some of the burnout. It helps us if we were to twice weekly just take some time, just like we did today, to say thank you to ourselves, to say thank you for something that we're appreciative for. And I'm going to turn it back over to Dr. Priestley.
Okay, so it's hard to be angry when you're grateful. There's just no room for other emotions in there when you're experiencing gratitude. But it takes more than just you, right? It may be contagious that if you do that to some person, they're going to pass it along, but it takes a culture. So how do we build a culture of gratitude? Gratitude needs to be hardwired. It can start with something like a gesture, talk the talk before you walk the walk, but you really have to feel it in order for it to be genuine. It has to be voluntary, right? You can't just start with an agency initiative to be grateful for everyone. You sound like a nut, right? If you haven't done that yesterday and now you're saying, oh, thank you, yeah, I'm so grateful for you. It's going to sound a little odd. So it has to be voluntary, and you have to maintain authenticity. So, I think it's a slang now for younger kids. When I go buy coffee or something, they say, I'm so grateful for you. And I'm like, you don't know me. But I think it's a slang. But it's a nice slang. If it's going to be slang, you might as well say something nice, right? But they're passing it along, and maybe they are grateful for serving, and then you're grateful for serving in the way you serve. So authenticity. Make it a year-round activity. It's not just during Thanksgiving. Build a resistance toolkit. We've already talked about this. Very important, right? And we talked about resilience, and we don't need to define it again. But I do want to go through some of the techniques quickly that I've learned as a psychoanalyst that can help. And if you're in the moment with a client, and you're feeling some kind of experience that you're feeling that you think is getting in the way of the treatment, you can develop an observing ego. Okay, so what this means is that you're going to notice that there's something going on with you emotionally, and you want to identify your feelings then. Okay, so what am I feeling? What's going on here? Why am I feeling this way? Did the client say something? Is the client triggering something in me? What's happening? Hopefully you're not thinking about the dress you're going to wear tomorrow. You're thinking about the client because the client's in front of you. Realize that this is about your client. Put your feelings aside and then think rationally. How can you best help your client? So you have stepped out of your own ego to take a break, to think very quickly within a matter of seconds, what's going on with me? Why do I feel like this? How am I going to help, right? And then get back to your client and do what you think they may need. That's an observing ego. Also, in the moment with a client, if you're feeling confused or you're feeling that you're having a lack of empathy, let your thoughts go, become an open vessel, allow yourself to be filled up by the client, and the client's needs, become the client, step in their shoes, until you can connect with them again and get some empathy. And then step out, return to yourself, think of what the client needs, and proceed to help them. Okay? That also involves the ability to recognize, leave your ego, think in your frontal cortex, problem solve, and then carry out what you need to do. So your feelings are always important, but it's how you act on them that's really helpful to the client or not. You may have too much empathy when you're with the client. So again, stop yourself, think of something pleasant, right? I've never cried with a client, but my eyes well up with tears sometimes, and it's kind of obvious, but they don't spill out. So sometimes what I do is I think of something pleasant, or I roll my eyes back a little bit like this when they're not looking, so it doesn't look like I'm rolling my eyes at them, and then the tears go back in the back of your head. So there are some techniques. Make boundaries. Realize that the trauma is not currently happening with the client, although it may be, because in your profession it may be. In occupational therapy, it's not always the case. And in psychoanalysis, it probably already happened. But in a lot of cases, realize it's already happened and that the client needs your help. So they want you to be strong. You know, they don't want you to be upset. There's so many different ways that you can show that you care by listening, the way you ask questions, the way you carry out your treatment, that you care about them, and ground yourself. So I don't need to go through these. You're all aware of your particular health care favorites. And thank you very much, and I am very grateful for all of you for being here and for listening and allowing us to speak today to you. Thank you.
Oh, no, that's great. Thank you both very much again. And so now it is lunchtime. So thank you guys for staying with us. And so everything will be downstairs in the lobby. And we've got the history room in 427. We have the poster session in 115. And so some other things planned for you guys downstairs. So enjoy.
Hi. Hi. Good afternoon and welcome back for our last program of the day. It starts at the root, a recipe for health. I'm proud to introduce Mei Yong, who received her MS from Columbia Nursing in 2014, and Julie Johnson, who received her BS from Columbia Nursing in 1979. Both career changers. Mei is a former chef and restaurant owner, now turned nurse, and Julie is a nurse turned winemaker and farmer. Julie is the proud owner of Tres Sabores, a winery and farm nestled in Napa Valley. Wine offers the ultimate social experience when enjoyed in moderation, with thoughtful, healthy food and great company. It is important to address the main topic of our gathering, preventing personal burnout in healthcare professionals by assessing personal nutrition, education, and connectivity to the land. Understanding regenerative farming practices and how it links to personal health is truly connecting for your mind and your body. Learn about practical lessons in moderate wine consumption, the old and new prohibition movements, and women in wine, Wine Sense. Former executive chef and restaurant owner Mei is a current NP that advocates for the emerging field of culinary medicine. It is one of the most effective tools clinicians have for educating ourselves and our patients about eating better. This new evidence-based field blends the art of food and cooking with the science of medicine. Empowering ourselves with this knowledge makes us more likely to improve our own health, educate our patients, and prevent burnout by viewing cooking in a new light. Educating ourselves about culinary medicine, opening teaching kitchens, and recommitting ourselves to disease prevention are some of the ways that we can take our power back and find inspiration again, all while enjoying our own time spent in the kitchen. I'll now turn it over to Mei and Julie so we can learn more about the importance of what we consume and how it impacts our health. After their conversation, Julie will tell us a little bit about the wine she's serving today, and Mei will perform a cooking demonstration of a nutrient-dense, plant-based meal. Today's event will be concluded with a wine and food tasting. Let's welcome Mei and Julie.
Hi, Mei.
Well, hello, Julie.
Can you hear us?
Can you hear me? Okay.
Great. This got started because I was here 5 years ago for a reunion and offered to pour some wine. And so it kind of happened again, but this time because of the theme, we talked about what we could do to take it a little further. And in the last 5 years, I've been spending even more time in my farm and in my farming and winemaking profession, talking about health and, more importantly, talking about the connection between soil diversity and farming healthy soils and creating the foundational part, of course, of winemaking is high quality fruit. So farming for high quality soils to create great wine is one of the things that I'm really committed to. But I thought that the talk this morning about resilience is really key. Nurses are resilient, you have to be. But how do you sustain yourselves and how do you work for that? I mean, I think building resilience in ourselves and our clients and our environment are all things that are really linked. So I have 52-year-old grapevines. And in the last 10 years especially, they've gotten themselves through drought, through fires, through incredible sustained climate crisis types of drought events and heat events, and they have sustained. Well, I have to draw conclusions that other people have drawn who are practicing farming the way I am, and that's because we have been nurturing the soil. I've gone from, well, I've actually never been involved with what you would consider conventional farming, but I've definitely gone from tilling and disrupting the soil and not paying that much attention to the soil organisms and the diversity of the entire environment that I'm working with, to really intensely paying attention to those things now. And as May and I got to talking about all of this, we knew that, we kind of talked about the idea that everything in a way, grapevines are hardwired for longevity. 52-year-old vines, that's hardly known now in California. I'd like to think the nurses are hardwired for longevity, especially in nursing as well, right? So that's what this is about. But in a sense, we're stewards. I've become, I think, a wiser steward of farming and working with my vines, but working with my pomegranates and my lemons and my sheep and my goats and my dogs. And I'm not really fond of Stellers, jays, or squirrels, but I suppose they're part of the system too, So, oh, and by the way, I started nursing school here when I was 10. No, somebody said that. Not 7, just 10, anyway. But, we want the idea of developing resilience in ourselves and in our food systems to be not only foundational, but really pleasant. And so we're kind of here today to give you the pleasant side of it, right? So
I'm so happy and grateful to be invited to speak with Julie and to speak with all of you today and to share a little bit of my story and what brought me here. Again, like I was introduced, I was a former chef in the San Francisco Bay Area. We do have this in common. We're both actually quite close to one another over there. Found our way to New York for this wonderful program, this wonderful school, and have made our way. I'm so grateful that Columbia has taken a chance on me as a second career student. I didn't enter nursing school until I was 40 years old and had a business for 20 years. So for me, when I look at nursing and I look at resilience in this field, I ask myself, do I have what it takes compared to cooking and compared to the endurance required in the kitchen? It's a different type of endurance. I feel like it's more mental endurance more than physical. Mm-hmm. In kitchens, I work 16-hour days, 6 days a week, but it was one and done. Each night was a performance, and you couldn't make it up. You couldn't do it. There was no do-over with each night. And you didn't take that stress with you, even though having a restaurant is stressful as far as management, as far as hiring, the bottom line. But at the end of the night, the performance was done, and I couldn't worry too much about it.
Yeah.
Nursing, you carry a little bit of the day with you each day. It's a little bit more stressful in a different way. Some people would call it a little bit of toxic stress. You worry about how the day went down. Did you do your best? What can I do to do it better the next day? So when people ask me what's the difference, because both fields require a lot of stamina and a lot of endurance, but this little bit of toxic stress is something you need to overcome and learn to overcome in nursing that I didn't have in the kitchen. I think the kitchen prepared me to work in the operating room to start when I first started, and then in medicine, and then now in vascular surgery. But yeah, that's what I would say, is that what are the techniques and what are the strategies that we have to build, because this is an endurance race.
It's an endurance race, but we also were talking about the fact that we're probably the most, in our own ways, but especially nurses, are most connected. You're constantly building a community. I worked here in this community a little bit with women's health and young teen health. Then I worked in upstate New York, and then I met a winemaker, and then it was all over. We moved to California. Funny, how did you become a winemaker, Julie? Well, I married a winemaker. And then I married another winemaker, but that's okay. Actually, I swore off winemaking and men named John, but that was the problem because the second man was a winemaker and named John. So I don't know how that fits into connectivity and resilience, maybe fallacious, but he's a great, having a good partner, having a good friendship network, I think is really part of it. But to get back to the connectivity thing, I'm interested in your connectivity to food, because you're connected to patients and to health. And we've talked about that, because I go into a farmer's market and I think about how many people just go to a farmer's market and everything is cut beautifully and nobody sees the roots. And I mean that both figuratively and literally. Like, what is the connectivity, and what's our potential to develop that, right? So it's a bit of a stretch to say, hey, I want you to become more connected with wine, because yes, that's part of my life. But I've always thought and experienced people who have a big barriers to being connected, most importantly, to healthy food systems, for many reasons. We can talk about that later. But, in some way it is the roots. People in conventional farming have always farmed at a plant or established almost an artificial relationship with the food. It's mediated by tractors or by chemicals or something like that. With nursing, we're trying to get away from that, right? But you had that connection most viscerally with food. What kind of built your connections with food, and how are you taking it now?
Oh, goodness. I think that you have to trust your 8-year-old self. There's a part of you from that period of time that was fearless when it came to any endeavor. I encourage everyone, and I tell patients that as well, to not lose sight of that person you were. My 8-year-old self loved the kitchen. And so after graduating from undergraduate, prior to coming to Columbia, I actually ran off to San Francisco to go cook so that I could pursue that career and commit and dive in. What I did in the kitchen for 20 years was to train my attention to how a team moves, how diners move, working together to achieve that goal. And it's really a dance each night. I don't look at a piece of fish to tell me that it's done or that the skin is crisp and perfect. I listen to it, because when a wet piece of fish hits a hot pan with hot oil, right, it's going to be very loud. You're going to hear lots of popping and bubbling and all of that. It's very loud. Once the water evaporates and the skin starts getting really crisp, then it's oil on oil. It gets very quiet. So you can put 2 or 3 pieces on the stove ready to go, plate a dessert, do a salad, and get back to your perfectly crisp fish. Flip it over and you're all set. That's training your attention. in nursing, that's what the motivation was for me in this field, is that I spent 20 years training my attention in one field. Do I have what it takes to do the same in nursing? What does training your attention in nursing mean? Does it mean being so attuned to your patients that you can foresee almost what's going to happen? Remember the old joke about you don't worry about the patient down the hall that's coughing and gagging and wheezing, because at least they're breathing. You would worry about the quiet room, right?
Yeah, that's true.
So that's training your, a simple example of training your attention and anticipating what can happen with your patients. Right now, with what I do, I educate and train patients so that they can care for themselves after a major vascular surgery. I tell them what to look for in a wound. I tell them to look for signs of infection. I show them how to change dressings. I have them videotape me as I'm changing their dressing so that a visiting nurse at home can do the same thing, and they can show them what we did in the hospital.
Boy, I wish I had that tool. I wish I had that kind of tool or instant camera access when I was, in the dark ages back in Napa and in the hills in the 80s. We didn't have those tools. I counted on patients' cats to tell me what was up. Actually, I did as a visiting nurse. I encountered quite a few protective animals, including this Persian cat that was this big. I like what you're saying about the sound, and I found some connection because when I I was kind of thrown into the wine business, like we're starting a winery, hello. It was Frog's Leap Winery, if anybody's heard of that, and it was maybe the 51st winery in the modern era for Napa Valley, that's where I live, and we sold our motorcycle to be able to buy grapes. We were not heirs to some banking fortune, which I wish we were. Oh my gosh! But all of a sudden, I'm thrust into there, and then just a few years later, started having kids. But also, we moved. We'd been talking with growers that were helping us, that were selling us grapes. When we finally bought our first vineyard in '87, where these wonderful Zinfandel grapes were planted and had been for some time, I was still struggling to kind of make my connection, and I found it because you are all very tuned. Another sense that I think we use particularly well is a really ancient sense that a lot of people have lost, because I think nurses do this really well, and it's smell. We all know when you walk into a room when a patient is not doing well or when a wound is infected. So one of the things that I did fairly early on was I brought animals into my system. I had to do something with my skins and stems and seeds, byproduct of harvest. I wanted to do something naturally right on our property, something that was linked to the past but also could make way for the future. And so I started to make compost. And the way I did that was to bring in animal systems, and we sort of made lasagna. food reference, although a little icky, but those animals were smelly unless I brought in guinea hens and hens that would eat the fly larvae, and I knew to start putting in straw, and I knew to get the animals out in the pasture, and then out in the vineyard, and then when they were, I started to notice that picking up soil or grabbing composted material out of the compost bin really smelled good. And not only that, I knew when it smelled bad. I knew, and then my wine tasting and smelling, I guess, faculties started to improve and and I got more tuned into wines that were off, that were contaminated, that had dusky, musky kind of characters that were really unpleasant to me. And I think actually part of that is being a nurse and knowing when there's funk and there's microbial, yeast funk, and when something is not going well. And I began to be, it's really attractive to know what something smells when it's really good. So often if you come to the winery, I'll probably dig up some soil, complete with earthworms and all of that, but have you smell the health of the soil, because it's as diverse and as complex a system, an original system that I think leads us to our connectivity with our own gut and with our own
Very
thing.
true, very true. When Julie and I were talking on a couple occasions prior to this event, it was so wonderful to find someone as attuned as Julie when it comes to mindfulness. I try to be mindful in my practice, but also when I cook and when I share that information with patients and the general public and other nurse practitioners. And I can see how devoted and mindful you are to your practice as well. And what I think that more nurses should know, and part of the reason why we're doing this talk, is that we're all connected to the health of the planet. We're all connected to our gut health, our the soil health, all of that. And we want to share with you a little bit about why that's so important.
Yeah.
Julie, you alluded to gut health. When I was going to school, I think just then they were starting to get microbe samples from students and college students around the country.
Microbials.
And they were using,
yeah.
yes, and they were using these specimens to start helping to create and do the research on the gut microbiome. And now there's so much information out there about the health of your gut, how actually taking probiotics right after surgery might not actually be the best thing, because it actually shows that it reduces the diversity in your gut if you actually load up heavily on probiotics. There's such fascinating research out there. There's so much of a connection between our gut-mind axis and how if we feed a wonderful, diverse gut microbiome, that will lead to a reduction in many things, a reduction in autoimmune issues, a reduction in possibly mental health issues and imbalances, because now our system is functioning the way it should and we're cultivating the farm within.
Nature has a way of working it out in balancing. Sustaining, which is a big word that you hear now with farming, like what's sustainable? Well, for me, what's sustainable is it has grown in a definition as well. So it's not only being able to have a plant or a soil system that can be active and productive for maybe even ancient theory, 7 generations. That's a very sustainable, but now it's grown to be not only sustainability and resource development and utilization, habitat conservation, and the propulsion of your systems to be more diverse, because nature really does want that, and it wants to balance. And so the other aspect, of course, is that farming hasn't really thought about traditionally, and that's the social justice aspect. So if you have people who are working in increasingly an environment that might be extra humid or might be extra hot during the day, hot human conditions can propel more grapevine diseases and propel conventional farmers into more use of quite caustic chemicals. It's getting better, but it's not great by any means yet. And that can really interfere. That interferes with diversity. It's diversity in farming. It's diversity in the micro. You all know the thing that there are something like 3 billion microorganisms on your, the space of your thumbnail if you're digging into soil. Well, we've also, just like the research you're doing in nursing, I think, is we also have more capacity to look at soil composition, and including the diversity of microorganisms. So when we have bacterial-rich, fungi-rich carpets of microorganisms in the soil, there's a very special relationship between the roots that grow very deep and very broadly in a very microfilamental sort of way, and the bacteria that work with them very symbiotically to create, they trade substances. The bacteria stimulate the roots to form nodules. The nodules, the bacteria can pull nitrogen from the air and convert it into a form that's highly utilizable by the plant. So it's not pouring nitrogen on the plant that does it, or probiotics or sugar or whatever else into your body. Just like the soil, we know that just pouring nitrogen in and trying to make things fertile and trying to make things productive really doesn't work. It's really promoting those natural systems. The density of our farming process is also really important. We're just like for human systems, oxygenation and hydration are key things. Compressing the soil, running more tractors over than you really need to, compresses the soil, reduces the oxygenation of the soil, and decreases the ability of that microbiome to be sustaining and productive and alive and healthy. So all of these things, and I tell people who come to the winery, I go, okay, it's just, you're looking at the farm, I'm digging up the soil for you, and it's just like your gut. And they're like, what? But I'm happy to be in a room where people understand it and are not afraid to talk about gut. Because my husband why are you talking about gut health with people who all they want to do is just drink your wine? It's like, but it's got to be okay. Again, it's that connectivity. So those rhizobial, bacteria are just one of those things that we're looking at that, and we need to propel ourselves into being more conscious in all ways, right?
In all ways, yes. One of the first culinary medicine conferences was started by David Eisenberg out of the Chan School of Public Health at Harvard. And he was probably one of the first students in the 70s to ever travel to China on a medical exchange. I'm so inspired by his story, and I actually went to his conference when I was a chef. I was probably the only cook attending that wasn't working the conference, but they were bringing medical professionals from all fields to talk more about not only the gut-brain axis, back then we didn't talk about that, but all about how medical advancement and surgical techniques and all of that have not paid enough attention to food as medicine in the beginning. We overload patients with medications. We give them medications to treat the symptoms and the side effects of other medications. How do we go about reorganizing ourselves and reorganizing our patients so that we are harvesting their own natural immune system, we're harvesting their own catabolic processes and metabolic processes so that they are healing themselves without the aid of multiple medications, multiple pharmaceuticals that may not be necessary. I think that going to this conference now as a clinician, I'm finding that there's such an explosion of interest in this. How can I really help my communities? That's the question that this conference really asks. How do I help my community? And the thing that they propose is to start teaching kitchens everywhere you go, everywhere and anywhere you go. If you have a clinic back room, a 6-foot table, and a flat top, you can have a group class and for your diabetic patients and go over healthier cooking, go over nutrient-dense carbohydrates versus simple carbohydrates. You don't need a fancy kitchen. I have a flat top there and a 6-foot table. That's what most of our patients have at home. So if you can show them how to feed themselves on less than $20 a day very well, and if you teach them these skills, I think you're starting at the root. You're starting at the root.
Well, I don't know about you guys, but when I was at 20, with Phyllis, my dear roommate back there, what were we, 23-year-old starving students, right? I was going to the clinic down here and giving my blood so I could buy our dinner. Seriously, that's what we did. And yeah, well, we didn't know, I didn't know how to cook. You know what I didn't really realize that there was a whole new science, really, of culinary medicine. So there's the CI, Culinary Institute of America up in Hyde Park, and they have branches out in California. They have a big conference on food and nutritional health coming up. 5 nurses should be speaking at that conference. We need to integrate ourselves with that food system that you came on. And I have the luxury of being able to communicate with that system. Another one of my connections to wine, quite frankly, is I love to eat. Who doesn't? And for me, wine in moderation and knowing it. I kind of determined a long time ago that I have control but I also have friends whose friends or friends themselves who lack the control, lack the tools to be able to deal with alcohol and to measure that or to meet that. One thing that we all have in nursing is being very sympathetic to that and helping to people to what? Identify when they have problems and support themselves. What happens a lot I think in my current food and wine culture is a lot of those problems get buried. Oh, that's just part of the culture or something like that instead of identified. So I don't want to let that piece of this go by, but I think what you're really saying here and what I'm so intrigued talking to you about is this is really a call to action. Why can't, my son-in-law is one of the trustees of our local community college and they train AA, they train aides and all of that. Oh my gosh, we're in one of the culinary capitals of the world. Why shouldn't we have a teaching kitchen there for AA students?
Everywhere and anywhere, for students, for other nurses, for other nurse practitioners. I want to say that if you ask yourself who has the most influence on patient care, who has the most influence on patient coaching, who spends the most time with patients on a daily basis, it's your nursing staff. So instead of being just pill pushers, I think that the nursing staff has more power than they think they do, and nurse practitioners have more power than they think they do when it comes to nutrition education, lifestyle modification, healthy behaviors, balance in our lives. We visit patients at home. We visit patients in the community as well, like our wonderful, primary care practice here. And we do have more influence than we think because we do spend so much time with patients. And I think that if we reiterate these messages over and over, that's what a coach does, they're likely to get through and more likely to get through. I think that in the acute care setting where I currently work, that's fantastic. Changing vent settings is fantastic when patients really need it, but health is in your community. Health is your zip code, and we all know this.
Well, I want to talk about that and go back to the idea of stewards, because I think that's a farming term we talk in modern organic regenerative soils and soil health and certifications. That's my language, and we're learning more about that. But that really is what I think we can do. There are a couple problems with that because it's just not as easy. As far as how we're growing our food and what barriers we're up against, and I think even more towards that we can do something about is access to food, because we all know that increasingly access to food is skewed towards affluent and educated people in certain urban settings. But I've sold wine in Atlanta for 40 years, and I walk almost literally across the street and down a couple of blocks and see areas that are food deserts and think, who's going to change this? And think we're really powered to do that. But even more importantly, we all can make some decisions now that influence farmers. You can make decisions in what you buy, foods that are wholesome, whole foods, whole grains, whole vegetables, you're going to see from May today. And that word does get out gradually. Not necessarily even organic foods, but meet the farmers, teach people how to do that. Go to bodegas, see what's there, and see what kinds of things that you can do that push that continuum a little further towards that. We're having a really hard time in terms of climate change affecting what we're able to eat in a few ways. One, producers are aggregating and consolidating and narrowing the number of types of vegetables. If you look in the store, there are 5 types of apples. If you look in the store, there are 2 types of rice. And you look in the stores, it just goes on and on and on. You can help make the diversity of farming, which brings health to a farming system. Diversity in all regards, not only the birds that are there, the insects, the soil organisms, that will help provide, in the end, access and climate resiliency. Narrowing the field, narrowing the selection reduces our climate-wise availability of nutrients in the soil and in the products that we use. We're not healthy if we're eating one type of meat in a day, one type of fruit in a week. We're healthy the more diverse our systems can be. So, I think this really is definitely. So really, the source of our foods is becoming more and more unreliable when it comes to the nutritional content. Having nurses, having community workers educated is just, that's when you started talking about this, it was just a revelation to me. And I think a lot can be done.
That's one of the major tenets of the culinary medicine movement, is that you want to definitely increase the diversity in only what you consume, but also what your community consumes as well. We're so lucky here in New York that they've made commitments to this. We're not the only ones. For example, the fruit stands that we see right outside
the door.
The fruit stands are a public health priority. They're subsidized by the city. And it's so important to have these in neighborhoods where there are food deserts. Additionally, in New York City, we have open schools, the high schools I know. They have summertime meal programs where breakfast and lunch is served all year round, even when the schools are closed. The schools also here in New York, the public schools, many of them have food pantries as well, so that when parents drop off their children, they can easily pick up some groceries, some items, and not feel stigmatized by going to, pick these up. I think there's some wonderful things happening here in our community, and I'm hoping that we feed off of this and make sure that everyone has access. Like you said, it's a social justice issue. I think that teaching patients, teaching my community, teaching my people how to cook not only is an exercise to show off to friends, a way to put on Instagram what you've made. To me, it's so much more than that. To me, it is a social justice issue. If I know how to cook and prepare for my family affordably, I'm going to be spending less on medications. I'll be making fewer trips to the physician's
You'll see
office.
fewer patients.
Or then I'll see fewer vascular surgery patients, which I would love to see less of in the future. Yes.
I want to speak to the, I noticed that fruit stand there too, and I think that's great. And again, having nurses, maybe you do a rotation through that, but I think it's important too to not lose track of communities like mine, even though Napa has a lot of frou-frou stuff going on, but it's really basically a grassroots farming community, and their access to foods, transportation issues, even to beautiful gardens and so on, are big things that I think we need to look at. We haven't really touched on something maybe we should end with, and that's, in the end, we'll return to it, I guess. For as far as avoiding nursing burnout, how many people loved the relaxation techniques and all of that today? Those were just so helpful. Remember that you're nourishing yourself, and whether it's being moderate in alcohol or whether it's paying attention to what you're eating and what your family is eating, that is such an important. You are the picture of health, and I just think it starts with us. It really does. So, learning how to cook better, wisely, utilize the range of foods that are out there for our health is it's great for our head to begin with. As was pointed out today, there's more to that. It's the internal mechanisms. It's great for our gut, we know that, but I think it's great for us, our ability to be able to go out to nourish ourselves, to sustain ourselves, and to sustain our community.
I think that there are some takeaways, some pearls from all of the culinary medicine conferences that I've attended, and they're very simple. We don't try to teach people or say what foods are good, what foods are bad, per se.
And there are cultural differences in
there are cultural
very big
preferences as well. There are no food traditions, cultural, historical food traditions that are bad for you. Eskimos have limited produce supply where they live, but culturally, the food that they eat has sustained them for generations, for millennia. Why is that? Seal blubber is really high in vitamin C. You don't need citrus if you eat whale blubber or seal blubber. So traditional foods that have sustained generations, sustained a culture for so many years, are good.
So if we pay more attention, I want to go to the next culinary. Who wants to go to the next culinary medicine conference? I mean, I'm psyched to do that, and I think it's just, but all these professionals, all these researchers are learning more and more about that. In my field, there's more research going all the time, finally, about organic systems, organic growing systems, and avian systems, and insect systems, and conservation habitat development, and so on. And so it's wonderful to know that's there. That's a good challenge for us. If we're all who knows a nurse who's not a lifelong learner anyway, right? So
sharing simple messages with patients is important. Consistently coaching them is important. Setting an example is very important. At the latest conference, what we did was ask ourselves, what are some simple messages we can share with our patients that will be very easy to remember, that will encourage them to do more? Definitely, we say, be as active as you can. Exercise is not just the gym. Exercise is picking up your children and playing with them. Exercise is shopping and groceries and moving and house cleaning and getting up to the 4th floor walk up every single day. That's exercise as well. Also, we say try to eat in a 7-day period, 1 week, at least 30 different produce items.
Oh, cool.
30 different produce items will give you a diverse diet. Spices count. A diverse diet which will provide the nutrients that a body needs. Why do we eat vegetables? Why is everyone espousing fruit and vegetables? The reason why is because they provide the micronutrients our body needs. Boron, selenium, magnesium,
zinc, calcium,
copper, zinc. That's all found in produce. That's all found in fruits and vegetables. And that's why plant-based meals are so not only nutritious and tasty, and inexpensive, and a social justice issue, but learning to eat that way and learning how to eat that way has been shown to also lead to longevity so that we can keep doing what we do for longer.
Well, if I have to go to a store and find, or a market or whatever, and find 30 different examples of that, in doing that,
in a week,
onions
and garlic,
you're teaching yourself to
right.
And you're educating the farmers to promote more diversity in what they grow, and in knowing that it's important to get all those nutrients. The foundation of nutrition, that's the foundation of soil nutrition as well. We're looking at all those elements, and if you can do that, you're pushing farmers to educating themselves and to pushing themselves in that direction of productivity and diversity, because you need to be able to have that diversity. Those microorganisms depend on diversity and balance in order for their systems, the growing systems, to use those nutrients. Good nutrition, good air, good water. Those are all developmental factors that are necessary to health.
Absolutely, absolutely.
How about some food and some wine?
Okay, very good.
Do you have any questions?
Any questions? Yes.
Mm-hmm. Are there any doctors that attend the culinary medicine conferences?
What's really fantastic? A lot of family primary care providers are there. Very few cardiologists are at these. But
do they wait because they think they know?
Well, the thing is, they might go out of business if more people do this.
I was looking at a program recently. It was talking about the fact that over all the years, I don't remember how many, the little hardware stores and communities, there was a big merger at Home Depot, and they were talking about the fact that during the pandemic, it was realized that there are basically 4 or 5 corporations controlling food in this country. And so my question is, we're always hearing that rural communities feel left out and farmers are in trouble, you know, little farmers, whatever, little means. What can be done about that?
Well, recognition that it exists among politicians, for one, and building and funding and stressing to your legislators, especially rural legislators, that they've got to take care of their own. I mean, I think those are just, it kind of almost has become kind of a political reality that people have to have that. You're absolutely right. I was reading an article the other day. I think there may be 3 now, there's a merger that's being contested, but if that merger goes through, I think that there are 3 major grocery store chains that control, each of them maybe control 10 or 15 different kinds of brands, but they're all coming from the same thing. Their focus is to make it easier for themselves to distribute things. Whatever the label is, it's a focus rather than a push towards diversity. And I think I have a solution because I hit that too. I'm tiny farm, tiny winemaker. So my wines aren't in Total Wine or big warehouses. My whole call to action on my group and the way it affects me is that I ask businesses to pay attention to other independent and small businesses. So again, supporting those small businesses they're likely to be small independent businesses. It's important to do that. People can get the word by having those businesses survive, right?
Well, one of the
go out of
best
business.
ways, one of the best ways is shopping at your farmer's market anywhere you can, because these are stands that come weekly, or bypassing the market and getting a CSA box each week or every other week that meets the
Well, there are new
need
grants, for
your families.
example, for black farmers, because the proportion of smaller farmers, especially farmers of color, has been decreasing every year. So now I know in California there are new grants to support those farmers, and my organization, the organization that I'm certified by, California Certified Organic Farmers, I don't know what's happened, but the funding recently has really come forward to say, do you know people who want to do something in their backyard, or people that are neighbors 20 miles away that for some reason, are stressed, are deprived of an opportunity to find nourishing food. So that's a movement that is starting to happen to keep the small family farmer, to keep the small family backyard, or to keep the urban community gardens going and strong and staffed and volunteered for. So I don't know that answer. It's worrisome to me. I look at where my friends purchase grapes from the Great Central Valley of California, and what do you have there? You have literally vaporized soil. You have subsidence of soil because they've drained the alluvial water systems to the aquifers to nothing. So the soil is sinking. The soil is sandy, the soil is salty, the soil is deprived of nutrition. And what's happening in the population? It's one of the highest places in the world for childhood asthma. Forget about nutrition. So it's, that's not being able to breathe is essential, right? But it really does mushroom. Nutrition, it's a big problem. But nutrition really does stand at the core of that, I think. So we're trying to advocate, and the good news is that I see my colleagues being more and more progressive. We have a lot of tools, using animal systems, making compost, making biochar. If you want to talk about that later, I'm happy to. Making, just giving ourselves more diversity of planting materials with plants that we plant between our vines or in the periphery of our farms for diversity, even if it's a monoculture planting to kind of counteract that. And my goal is to emulate nature. I'm an ag A lot of people believe you have the right to farm, and I think that's true. But you don't have the right to so ignore natural practices that you really mess up the soil. I don't think that's right. And I think letting people do that. Sorry, I'm getting riled up. But anyway.
Okay, shall we? Yeah. Okay, very good.
One more.
Okay.
Can we do one more question?
Okay.
Back there.
Let's head over. Sure.
Okay.
Very good.
So,
yes.
Food demo. Thank you. And then come on back and have a glass of wine too.
Thank you, everybody. Thank you.